Wonderful.
This is my presentation. So why we visit? Well, I think I've sort of covered this already in the pre information, but basically the whole issue is people are experiencing a lack of companionship. So we have a situation where we have a lot of people in our community more than ever before who are lonely, and these are people who may have been active, and we know them. If in the case of Catholic Women's League as an example, and you're the example today. Obviously speaking, many of these people were active in your councils in the past or active in your community in the past, and today they're not. And it's not that they wouldn't want to be, it's that they're not able to be. So reducing loneliness and isolation is important. We watch for signs also of self-neglect or abuse. Now, I don't think that's something that is the primary purpose for the program. It's just something you bump into as you're visiting people. We provide a sense of belonging and value. So these are primary issues for these situations.
Can you hear me all right?
We can hear you fine, Kathy, so you take over.
Wonderful. Thank you so much, Alex and Genevieve, for that great intro. When we're talking about human needs, it's an honor, first and foremost, to be here today. Thank you all for joining us and for giving us some of your day. Like Genevieve mentioned, my name is Kathy Matusha Costa, and I'm so excited to be able to be part of this today and present with you alongside Alex. So when we're speaking about human needs, it's really key and crucial to kind of underline a few points. And I know because most of you have already been meeting with people or have met and have experienced meeting with others in the past, a lot of this is going to be a review. So let's move through it. And I'm going to highlight a few points that I think are really important here. As humans, obviously, all of us, regardless of our abilities or inabilities, our physical needs are the same in the sense that we are human and we all share the same human needs. You know, for example, sometimes when we're talking about exercising, physical needs may differ between people, right? My personal place right now is that I have 3 young children. My family is growing, and I have 3 children, 4 and under. So I have a 4-year-old, a 2-year-old, and a 1-year-old. And then I have a very young husband. He's 5 years younger than me, so he's quite youthful. So my physical needs are exercise in the form of the home and taking care of my family. Alex, for example, Schadenberg, has the ability to run, and he runs regularly and often. So, you know, we have different physical needs. So depending on who you're meeting with, a person of a certain capability may be able to exercise alongside with you or want to go for a walk. For my example, I'm going to be sharing a little bit of my family. My father, who's in his 70s, is at the stage where he's not walking often. And, you know, he'd go between the car and the home, but he won't necessarily be wanting to go out for a long walk or a brisk walk or anything like that. So depending on everyone, the needs are very different. So exercise is crucial. Some people will want to do and participate in some exercise, some may not, and that's understandable. When it comes to their physical needs, when it comes to nutrition-wise, you know, we see that a lot of time people have varying levels of nutrition, and sometimes you might notice there is a lack there of nutrition. Perhaps the person is losing weight or they look like they're dehydrated. Hydration is key, so we definitely need to assess that, and if that's something that's of concern, to make sure that you reflect on that and actually bring that to either your supervisor or your CWL if you think that is something noteworthy that you should mention, especially if their health is deteriorating because of it. One thing is with hydration is really key is that as we get older, hydration levels decrease. And so I often ask my mother, how much have you drank today? And I love that people are drinking. I'm seeing videos of people drinking, which is great. You know, and grab your water, grab your bottles, because, you know, hydration is so key. We in our bodies we actually have, over time, we lose our hydration and the ability to keep water with us. So among people who are age 65 and older, we find that taking medication, especially prescription or over the counter, plays a large role in the person's physical health. But hydration is a key component of that. And depending on that, when someone is dehydrated, the effects of the medication they're taking may affect them more or less, depending on their stage and hydration level. When there's less water in our bodies, for the elderly, for example, example, medications that dissolve in water require lower doses, and because they remain highly concentrated in the body. So seniors, we find we have more fat, they may have more fat in their bodies. So medicines that dissolve in fat, therefore may accumulate. That means the medicines remain longer in their body. And because the kidneys and liver do not maybe function as efficiently, for those reasons, seniors may actually require lower doses as well of medicines. So, and that's why we see a lot of times seniors may find they have more side effects from medicine than any other group. We find that over the age of 65 and up, over 90% of people take at least one drug per week. Now, this is a modest, very conservative number when you compare it to, for example, my mom. And I have, she has authorized me to share this, but she's diabetic. She has cholesterol issues, high blood pressure, issues. So she takes a whole barrage of pills that she carries with her. Usually it's like in a shot glass or some form of little pill component system where she actually distributes herself what she needs to take, but it's anywhere between 10 to 15 pills a day. So that's really crucial for her to maintain her health and physical needs. One more point here is if you have a person who's age 65 or older, they might find that they have more than 40% of people take at least 5 different drugs per week. So that's significant as well. And then 12% or more take up to 10 drugs per week. So my mom is already past that estimate, which, tends to be the norm or average. And so we know people react differently to medications. And, for example, depending on when, you're meeting with someone, they may require that medication. You definitely want to, ascertain if that's the timing they need to take that time to do that. So that's fine. Thanks, Genevieve. So on our next topic, when we're talking and addressing physical needs, and we want to move on over to mental needs. And mental needs are really key as well, because the mind is like a muscle. The brain works as a muscle more than just an organ, and the muscle needs to be exercised. So we continuously need to stimulate it. So for example, when you're meeting with someone, we need to have that stimulation to remain healthy. As the video mentioned, speaking with our people who are in our community who are elderly, is really crucial, and that stimulates the brain. So even having that one phone call a week, if you can't make the visit for whatever reason, is really crucial and important. Depression is a serious issue for seniors, and we see especially that dementia, and specifically things like Alzheimer's, affects 1 in 20 people over the age of 65, and 1 in 6 people over the age of 80. So this is a huge need here that we actually are part of the solution, which is you are bringing life, and you're bringing positivity, and you're bringing hope to people when you're meeting with them. One thing I wanted to highlight here too is when you're speaking of depression, it's actually a serious issue, very serious. I see it in my own family. Many people who are getting older, especially over COVID, have found that seniors with depression are 4 times more likely to have alcohol-related issues or problems than those who are not depressed. So definitely this is an important topic that we want to ensure that we are aware of. And, people, for example, that are in residence in long-term care, we see that the Canadian Coalition for Seniors Mental Health and estimates around 80 to 90% of residents in long-term care have some form of mental disorder, and that depression is present in approximately 50% of residents. So that's a huge number. And so that's something that you're going to have to navigate as well, maybe when you're meeting with people. And that's where socially that we come in. And it's so crucial because your ability to meet with people and to see them are part of their social needs. The lack of social relationship is a strong risk factor for early death. And we see this because, people really need that interaction, that social connection. And so even something as simple as a phone call, a note, a card in the mail is really crucial. And we find people really appreciate that, the small things. I've seen so many videos where people say that they hadn't met with someone for days, or hadn't spoken to someone, for example, for a whole day. That's a huge impact, and it has a factor on everyone. So that's a form of social isolation. And as COVID has continued, we find that is becoming an increasing risk factor for isolation, becoming, forming depression, and then ultimately forming other complications and issues, mental issues as well. So people often will fear that they are becoming a burden, and we'll see that often playing out with families So when you speak to them, they may not share this directly with you, but if they notice that you're coming around and, maybe someone who used to come around hasn't been doing so, they actually may voice this and say, I fear I'm becoming a burden. And that's their way of saying, this is something I need some help with, or some way that we can actually come in and be a positive impact and positive person who can come in and actually start to change that dialogue internally for that person by speaking with them, sharing them, and allowing them to have a safe space to share a little bit more about where that's coming from, where those needs that are not being addressed. And oftentimes it's social needs and people simply needing someone to speak to. This next one, which we're talking about, is tiredness. Tiredness, I find, is really important. And why is that? Because people often say, I'm tired. And I've noticed, again, with my own family, my parents, when my parents don't want to socialize, they say they're tired, right? And even myself, when I don't want to necessarily meet with someone, I'll say, oh, I'm tired, but I push through it. I often notice now that my parents don't do so. So if they know there's a function happening or something might be, involving more people, they'll say, oh, I'm tired. And that's something we may want to note, especially when you're speaking with someone, because oftentimes people will say they express they're tired, but what that actually means is they're exhausted from having to worry about what that next social meeting or that next encounter will be like, and what effect it'll have on them, or if it'll be successful, or if they'll feel positive after. So there is a sense of tiredness for people, but it's more coming from a place of they're feeling isolated, and they feel that it's too much work to engage because they feel they're being a burden on others. So definitely we want to counter that and simply say to people that, I understand if you're tired, we can take this on the phone, or we can do a different type of meeting, but acknowledge the person and say that you would love to see them regardless, simply because you're being with them. And that's the best point, is to really emphasize to them how positive it is that you get to share time with them just as much as they get to share time with you. And you can actually break through that tendency. Communication is key. And what we're seeing now more so than ever is that people have started to really kind of lock themselves in, feeling more and more isolated. And so what happens is communication obviously decreases. And that's a problem, and that's an issue. Why? Because people are finding that as time moves, time just moves, right? We know this. COVID, where's that last 2 years gone, right? And a lot of times people will just get older and they'll get kind of stagnant in their, own minds and their own belief systems. And for you to come in and communicate with them, share them a story, share them something uplifting, that's a great encouragement for a lot of people they otherwise may not have had access to. So you really are the hope driver in their life. And thank you so much for that, because they definitely appreciate it. And so the next point is when we're talking about spiritual needs, oftentimes people need a sense of spirituality. And this means, God in their life is showing himself to them, and it can be in different ways. So a spiritual need, for example, they involve your relationship with God. There's some people who are more religious and others that are more spiritual. So they may define themselves differently, as we know. The more important point is that we acknowledge what their spiritual needs are. And so one point I wanted to address here is we had a friend, Alex and I, who passed away this year, summer of 2021. And this woman was an incredible living saint. She lived late into, into her 90s. And one of the things I noticed when I spoke with her in the last few years was that she would say oftentimes that she needed a spiritual guide, a mentor who can help her move through her questions, because she had a lot of pain. She had a lot of suffering that she was going through physically and mentally. And a lot of things were coming up for her in later life that she wanted to assess and simply speak about and share with a spiritual person. And I found that was something that we really took on and wanted to encourage and bring her to people that could help her with that. So sometimes that requires a phone call, and asking that person you're meeting with, do you mind if I connect you with a pastor or a priest, or, maybe a sister, a nun, someone that can speak to them that, would be able to be a person who would gravitate to them in a spiritual way and actually be able to help them. And that's really important. So this woman got the help that she wanted, and she definitely found that need filled. And so existentially speaking, this is something really important where, as people are nearing older life, end of life, and I've been thinking about this myself the last year and a half, is, what do we need as young people, middle-aged, elderly, seniors? Where are our needs being met ultimately? Because there's places that are being closed down. Some people don't necessarily have access to their religious services or their spiritual centers. And that is a key thing that we want to encourage, especially as your group. You are CWL, right? Catholic Women's League, and you help facilitate that interaction. So sometimes it takes that extra prayer. Maybe you can actually share that time with them and pray. You can offer a song. Sometimes people like to do that, praise and worship, or a form of, psalms that will actually be sung together. And that's really key and important. For CWL, for example, we may come across this, is that you may actually come across people who have had abuse in the past, and it may have been in the church. And if that's the case, we have to be very careful with that, because that is something that will come up maybe in conversation. And as you're praying, perhaps there may be healing that needs to happen, and that need for inner peace is really important there. And for that person, maybe necessarily they may find this is a great opportunity for them to actually encourage them to speak more about it with someone in a more confidential setting, in addition to you or separate from you, maybe with their pastor or someone like a religious associate. Another point here is the need for giving. Oftentimes people want to be forgiven for something that's happened in their life, and or have an opportunity, for example, to play a role in their life for actually giving to others. So spiritually sharing their information. So these are 2 points which are really key here, 2 opposite sides, but maybe you actually may enroll someone else in that conversation if they would like that, to acknowledge their spirituality and to be able to move them further closer to their point of peace. Thanks, Genevieve. Wonderful. And so the next point here is when we're visiting. So this is my favorite point, my favorite topic. When we're talking about visiting, we want to ensure that because of COVID, a lot has changed over the course of the last, almost 2 years. And depending on where you're situated, we have various guidelines for your area. So for example, we would definitely want to encourage you to double check with the visiting center where you're going on, if it's a residential home, nursing home, a hospital, person's residence, how are they going to be approaching, personal protective equipment or PPE? What kind of protocols do they have in place? Oftentimes we see you may need to require, for example, if you're representing CWL specifically, you may want everyone to cover themselves with a criminal background check. So that's something really crucial in Canada. And, you would have to go to the police, you would give them information, and they would check your background and ensure that you have all of that taken care of before you go on your visit. Sometimes a parish letter would be required. In Ontario, for example, you would go to the church, and you can actually, if you're doing this as part of the church mission, you can actually go and have this background check done, and it's completely free. So, just would require a parish letter. And if you're attending a person at their home, or if you're going to be meeting with them, you want to make sure that you, address appropriately. Excuse me. They have, certain people have different allergies. So if you, for example, have perfume, they try to limit that. That's a good point to have and keep in mind, is simply because we want to ensure that, they're comfortable, you're comfortable, and more importantly, you have, the right kind of things in place. If you need to go outside or if you're inside, you find that that's comfortable for both of you. And of course, when you're going in and you're actually arranging the visit, you want to call the person that you're going to be meeting with and share what days or times work for you, and make sure that works for them as well. We definitely want to ensure that the person is not meeting already with someone else, that there's no conflict with some other family, maybe your visitors coming through. And if it happens to be that way, then we want to allow them to have that time and maybe either move our visit over or just reschedule for another day, because we don't want to coincide with someone else visiting, which may kind of interfere with them opening up to you and sharing and actually, growing this group, and especially the My Story project with them. And then what you do when you come in, you want to ensure that you're dressed comfortably, but you're also making sure you're wearing clean, modest clothing, nothing too bold. I was sharing this the other day when I went to, depending on the culture of the person you're meeting with, I attended a wedding, I think it was, and I wore black, right? And I like black. I just personally like the color on myself. And of course, at a wedding, this was an African wedding, so people were wearing bright, bold, beautiful colors. So by the end of the night, I was wearing one of these fancy kind of headdresses on my head, which someone graciously placed on me and allowed me to share. But depending on the culture, I know certain cultures really appreciate more colors, so that's great. Maybe you can, do the same for yourself for then. But for the most part, you want to ensure that you're identified. So if you have an ID or a badge number, you want to wear that for representing your organization. And something that identifies you, who you are. We don't recommend wearing perfume, like I said. And if you are not, if you're not feeling well, we definitely encourage you to not visit necessarily that day and reschedule for another day that works for both of you. And the reason for this is simply because, we don't want to take that risk of that person getting hurt or potentially getting sick. Something that may hit you for 1 or 2 days may actually affect that person long term, and God forbid, something worse. So we choose a time that's visiting that is appropriate for the person. And, knowing their schedule in advance really helps. If you have set a time and you're not able to go, definitely please let them know. And when you're visiting with someone who cannot speak or communication is an issue, you would love to go to, and prefer to go in pairs. So that way you can encourage dialogue with a group of yourself and another partner from the group and that person you're meeting with. So that way you can encourage more communication, and it's actually very helpful for the person too to converse with the three of you. And, definitely before you go, think of things that are fun and creative. Sometimes we do want to, we want to ensure that we bring some life and some happiness, and, people will really appreciate that extra touch. So if you have a beautiful song you can sing, or a poem you can read about the day or the hour, and it simply brings some positivity and life into the person in that situation, definitely bring that with you. I would carry that in an arsenal that you have with your, maybe a Bible or some prayer book that you use. That's really helpful, because especially as CWL, you may want to encourage that with your visits. Okay. Thank you. And so when you arrive, this is nice because you actually can, the first thing I do, and this is when I do anything, I go to anyone's home now. COVID has programmed me to come in and wash my hands. I don't know. Do you find do you agree? Do the same thing? Yes, nods. Yeah, I think so too. And that's fine, and that's great, and that's really appreciated. I myself have young children, and I ensure that when they come to a person's home, we go and we wash our hands first. And that's really considerate. So when we come in, we wash our hands. We ensure that your hands can be cold, depending especially on this weather, which we're having now. You may want to ensure that they're warmed. So when you actually meet with the person, if you do shake their hand, your hand is actually a place of warmth and it's not a shock. And, ensure that you're introducing yourself. Maybe if that person happens to be sharing a room or accommodations with someone else, the other person or individual doesn't know about that visit. So just acknowledging and saying who you are, stating yourself, your position and who you are. You can say that you're representing so-and-so, and you're coming into that visit as a respectful person, because you want to ensure that they feel that they are being seen and heard as well. And you're introducing yourself to the others in the room. And of course, always knock. If you come into the room, they may not be aware, or maybe they forgot that you're coming in. So you don't want to startle them. And knocking or ringing the doorbell before you enter is really important. Also, one thing is when you're coming into a space and, for example, they are, in a room, that room is their home. And so we want to ensure that we don't just invade their space and their privacy. That's their space, that's their comfort. So we want to ensure that we are introducing ourselves first, entering respectfully, and as they acknowledge you to come in, then you walk into the room, right? And you definitely want to ensure that you're introducing yourself. You approach them from the front, don't startle them from the side or back, and say who you are. Ask if there is a, kind of a noise factor, or someone's, for example, playing a radio or a TV in the background. Maybe you can actually ask them to lower that down first, so they become more comfortable with you, so they can speak with you and hear you more better. And also definitely try to sit with them or beside them if they are in a wheelchair. You definitely want to allow them to move themselves around and be comfortable sitting at their level wherever they are. And of course, being attentive during your visit, being sensitive, ensuring that you're kind is really key here. And, tell them what you're going to do. So if you are going to share something with them, be mindful of that, because they may not know what's happening. You may say, oh, I'm going to bring out my guitar right now and or a songbook. You want to ensure that they know what you're doing and acknowledge that and not be surprised or uncomfortable. Wonderful. And when we're speaking to the person we're meeting with, language is very important. Oftentimes we see that people will say things that may be hurtful. And this is not, obviously, we don't want to do this. So, for example, if you're meeting with someone who has a disability, you want to speak with a person first focus. So a person with a disability, not a disabled person. A child with autism, not an autistic child. Or, for example, people will maybe sometimes say an epileptic. Well, that's not that, the way we would want you to say that, approach it. You actually are trying to place the person always first. So an individual with epilepsy. My husband, for example, he has a disability. He has early onset macular degeneration. So that's a diminishing of the eye vision over time. And it started when he was in his teens. And it's something most of the time people get when they're older. Well, he actually got it when he was younger. And he continues to lose his vision. So his peripheral and his visceral, like immediate vision, is affected. So when I meet, for example, with someone who may have a vision issue, or even for, has that disability, we can say, a person with that disability, and it's not a blind person, right? Like, we do not speak like that. And that's really respectful and mindful. We want to ensure also that if they happen to be in a wheelchair or use a wheelchair, we don't word it as, wheelchair bound or confined, because that wheelchair is something that's part of their lifestyle, and it's something that enables them to be able to be mobile and to move around. So being respectful of that is really key here. That's part of their boundaries, meaning part of who they are. So for example, if you take their wheelchair away from them, that may actually make them more uncomfortable. So we definitely want to be mindful of that and sensitive that, if we're moving their object, which is very important to them, we want to do so in a respectful way. And always definitely be respectful, which we know you are, and being polite, being cheerful, smiling, being an active, good listener. The way you're going to make them feel is just as important as they feel you are going to be feeling while you're meeting with them. So the way you propose yourself and the way you present yourself will be received the same way as they will actually hope to be received by you. So we want to be a good, attentive listener, give them time to respond, being alert, definitely, encouraging dialogue, listening more than we are speaking, oftentimes will be helpful and mindful of that, and simply being aware. So oftentimes, always asking first, never pushing or actually moving into a space or a type of situation that they're not aware of. For example, when we're speaking, we want to make sure that we allow them to speak, because oftentimes we can talk over ourselves, and we don't want to do that, right? So another point here is when we're speaking and you're visiting with a person, there's a lot of nonverbal communication that's happening. And so one thing that we want to make sure of is that there are a few things that are really key here. One is the way you listen, look, move, and react tells the other person whether or not you care. So if you're being truthful, and how well you're listening will actually come through more so than just through your actual communication. Nonverbal is key, and it's very important to listen. I personally love facial expressions. I think it's important. Eye contact and body movements are key here. And a part of that is with facial expressions, the first thing they'll notice is how your face reacts to them. So if I have this face most of the time, right? You know I'm not interested. I'm not really attending, right? So, and I'm not that way normally. Naturally, I'm a very smiling person. So I find that this is really key here, that when it's really especially important on how you feel about what they're saying. So the way when they speak, the way it comes through and they actually see and diagnose how attentive you are is how you react. So if you are attentive, alert, and responding accordingly, they will feel really appreciated, especially then, because they know they have your full attention. Touch is key. If you want to hold their hand, just ask them first if they are open to that. Some people may not want to be a personal, they're not touchy people, and only holding their hand if they're comfortable with it, and respecting if the wishes if they're not. So my husband, he's more touchy, he's more physical, he likes to hold hands, and I love it too, but there's limits. And I just find that, I personally prefer having my own space. That may not be them, or may not be yourself. So everyone's different. Voice is important. Being sensitive of the feelings behind the words that they're speaking is really crucial here. Responding and your intonation of your voice is key as well. Eye contact, so ensuring you have that eye contact, and avoiding eye contact is a big one here. So if someone, for example, they're looking down like this, that they're avoiding something. They may not be able to hear you perhaps. So that's a key point there to assess and see, can you hear me all right? And asking them those questions, prompting them and asking them, do they actually understand what you're saying? If your eye contact reveals that you are interested in what they're saying, then that's going to make for a better visit, right? So ensuring that it goes both ways. Body movements, if someone is sitting upright and very responsive like this, they're going to stand or hold their head. The way that they're positioning themselves is definitely a strong indicator of their feelings. So when you're doing the same thing, you're actually ensuring that they can hear you, but they can actually respond to you accordingly. Instead, take notice of how they move their hands. Are they fidgety? Are the hands tightly clasped together? That will show and be a big indicator to you of how they're feeling in that moment. They may not be speaking those words out, but their body movements will show you how they're actually feeling. And you can assess and actually change your own positioning and your own demeanor effectively in accordance to that in response. In terms of appearance, appearance may reveal a lot of things. So as you're starting to go back out to meeting with people, because people have been so insulated and isolated in their own homes, people may not be as comfortable, dressing up as much, or maybe even putting on a little bit of, something that shows that they're, in a good place. They might be starting off really kind of in a place of, that's how they are most of the time. So they're going to dress how they are most of the time, and that's fine. It's what they're comfortable in. But sometimes you may come across people who actually will have for example, clothing, they may actually, you may realize that their economic status is affecting the way they dress. So we want to ensure that we're respectful of that. Culture is an important influence of how people appear and are being judged. And even sometimes, if they're being cared for properly by others, will be shown by their physical appearance. And that's also something to note for yourself, that if someone is not being cared for properly, if they're wearing the same attire all the time, or if it's not clothed, if there's a hygiene issue there, then that's something that may come up in your visit. Just be mindful of that, okay? And something that you can actually speak to afterwards. If that's an issue that's becoming more and more apparent, that might be an actual care issue instead of just their choice or choosing. And the last thing is here where we're talking about space. So when someone is speaking, you want to respect that person's personal space, and being aware of that culture, their social status, any prejudices and history of physical abuse may all be factors affecting someone's need for personal space. So just being mindful of that. And it's important to be sensitive not only to the body language of the person, but also the nonverbal cues, and also the ones that you're emitting as you're meeting with them. The next point what we want to mention here is emotions. We are emotional people and beings. And when you're being with someone, you find that a person may be anxious, discouraged, or often frustrated. And that could be because of their situation, their emotions that day. It could be something that just happened right before you entered that room. And so we just want to give them the space to be able to reflect on that, or simply just to be in that place and be respectful of it. Recognizing is the first point here, that that something might be stirring in them, that they're unhappy. But that has nothing to do with you. It has no direct impact because of you being there. It's simply their state of being. And I notice sometimes there's that warming factor where you come into a space and it takes maybe 15 to 20 minutes for them to kind of move over emotionally from what they were going through into being with you presently. And that's really important and key, giving them that opportunity. When a person is angry or complaining, they need to voice their frustrations, right? So sometimes as women, I don't know if you have this as well, but we often just want to vent. And sometimes a man or woman will just want to vent, and they'll share with you whatever is bothering them. What's key here is it's really helpful for you to reflect back, actually ask them what they have said, and say, and kind of rephrase it and say, so what I'm hearing here is that you feel frustrated because Josie took your chair away, or whatever the situation may be, right? And so you're responding with acknowledgement. You may not agree with necessarily everything they're saying if it's more controversial or something that's really not present yet, but it's bringing to light that you acknowledge their feelings and you acknowledge who they are and what they're feeling, especially at that moment, and you're allowing to respond accordingly to be respectful of it. When you're being sensitive, especially, you want to be sensitive to the pain, any kind of physical, emotional, spiritual pain that they're going through. And that could come up in different moments throughout the day. I have a family friend, this is my husband's side, who has kind of an earlier onset of dementia starting already. And when we meet with that family, we notice oftentimes he will just start to cry. Like through dinner, he might just stop and he puts his head down and he starts crying. And I've noticed that's really common. And at the first start of it, I noticed a few years ago, I would become very uncomfortable and I'd come to him and I say, are you okay? Is everything all right? And then I noticed I had to take that back because that wasn't part of what he needed. It was simply him acknowledging his feelings. He was becoming emotional because he was happy. And oftentimes he'll see little kids running around, like our kids would come and greet his children, and that would really inspire him to be more emotional. Yeah. So one thing here I wanted to just reflect on is that we often have an opportunity to be very sensitive, be aware, and just simply validate that person's feelings, and then just come up and say, I acknowledge what you're saying. I know how you feel, and I completely understand, and that's more important than anything, just being with that person, right? So that's really important. So we're oftentimes when we are speaking with someone, we want to ensure that we are validating them, like I just mentioned. But one way is sometimes people feel that they want to argue. My dad is one of these. He's like I don't know what they call him anymore, but he's a bit of a ball buster. I guess is the best way to say it. He likes to confront people. He likes to antagonize. He likes to get people riled up and motivated and talking. And he likes to bring up controversial issues. And I love it because that's my dad. But some people may not appreciate that. And they may actually find it confrontational. So if you encounter one of those people, just be sympathetic, because those people prefer that type of style of talking. You don't have to agree with them, but we're not visiting people to argue with them. And that's really key as well, just to mention that. So encouraging their dialogue is great, but not encouraging argumentation or, discussions that we'll get into that is another point too. In conversation, we're speaking with someone, we're going to use statements that are something that is simple. For example, depending on their abilities too, when their cognitive abilities are, you may say, it's windy outside, right? It makes me feel cold, or makes me feel like I want to go for a walk. Some people may view questions as intrusive. So we want to ensure that we're using simple statements, more kind of broken down, simplified phrases that actually will help people be more communicative. And one thing is, when someone has memory issues, for example, dementia, they may ask questions that require a yes or no response. So being an understanding of that. And, for example, would you like tea? Yes or no. Would you like a cookie? Yes or no. Giving them the opportunity to respond accordingly to either of those two at that time is really key here. Asking one question at a time, encouraging them to talk about their past, that's really key too. If you would like them to reflect on something and they're able to, that's great. Sometimes you may want them only to make a choice. So knowing which ones that you can say at that time is really helpful, because it'll encourage them to speak more clearly and also be understood better. And definitely you want to encourage them to talk about your past, their past. And so, this is this is why you're there oftentimes. But, you may have a plan and you want to say, hey, I want to put, today I want to get through X, Y, and Z points 1, 2, 3, and we're going to do your story and we're going to complete that point today. But as you start talking, they may deviate and they may actually go into another area. They might start to go on a tangent, and you want to bring them to a place where they're comfortable to speak to you, because that's really the point of the visit, is to encourage that dialogue and that sharing and that really life affirming and person affirming visit. So talking about their past. Yes,
Kathy, I was going to say something because I was helping with an elderly physician, and so I was visiting him all the time, and we spent a lot of time together. And this whole thing about the past was very important, because if you had asked him what he had done yesterday or the day before, that was very difficult for him.
yes.
But if you talk to him about his past, meaning, his past medical experience, his past, what he did with his family, things from his childhood, yeah, that was fine. He was really good, and his stories were consistent. Like, it's not like he forgot it when I was making it up. No, his memory of the past was excellent, and he loved to talk about it. But his present memory wasn't very good anymore. And so therefore, that's what we ended up talking about always, his past. And I think that was quite effective for him.
Yes, definitely. That's great. I love that. Everyone has a story. So, and I know there's some questions too in the chat. Maybe Alex, you can discuss that if you prefer now or later. It's up to you. But if someone is talking about their past, I find it's really important, because a lot of the memories they may not recall, like you said, in the present now, today, yesterday. I, as a mom with kids, I feel like I'm going through loss of memory every day. And sometimes my husband says to me, what's your appointment today? I said, well, I wrote on the calendar, so I'm going to go look because I don't even remember. So one thing here is sharing memories with them. Definitely want to bring up good memories. So don't share negative memories. You're not there to bring up kind of anything that's going to upset them. Everyone has a story. So you want to ensure that your story kind of aligns with positive things that can happen or have happened in their life, because you are a positive, motivating person in their life in that moment. So definitely bringing up albums. People have albums. I have in my office, I have a whole shelf of albums from my family and my husband's family and our own family now that have merged. And, those are great conversation starters, going through pictures, especially if someone may be not verbalizing as much as they would like to in their conversation with you. They may want to just look at photos, and you can start taking notes and acknowledging and saying, yeah, this is who you were, this is what you did, this is where you went. That's great. And they really love that and appreciate it. So sharing memories can make the person feel young and happy again. And that's, I think, key. A good friend of ours had his mom in the last literally 20 years suffering. She was suffering through dementia, and he had her in a very prominent, very prestigious nursing home in Toronto. And so much so that he was paying for her care, which was up to $9,500 a month, per month. So she could have 24-hour care, constantly someone there. And as they found, the people that would be the best caregivers for this individual were people that were simply with her, sitting beside her, going through her memories, sharing with her stories, and they became family to that family. And so, he would bring oftentimes to her music, old classical love songs, from the 50s and 60s. And he found she really enjoyed that. And, bringing bands in that they knew that would, coincide with the memories that people had when they were younger was really key and important in that nursing home. So he really appreciated that. Thanks. Now, there are some don'ts for conversations, and the list is a little bit longer. And when we're talking to people, we definitely don't want to be impatient. Sometimes I find if there is a disconnect, if there's a person who you may not be aware of, because coming into a first visit, especially, you don't know what may be affecting them or what ability or disability might be part of their lifestyle. So you want to make sure that you don't infantilize them. And so making them feel like they're children, or speaking down to them, or lowering your voice or heightening your voice, depending on what you think is more important. But you want to speak to them just like you would have them speak to you. If you were just like, hearing and receiving information the way you are right now. And so we definitely don't want to make them feel negative in any way or feeling compromised, and making sure that the person is being recognized, that you may need to respond to the same question a number of times, for example. So for example, they haven't said how they felt, or if they need something, you may want to rephrase that or ask you again. We definitely don't want to argue. This is a key, again, bringing this up. Someone, for example, when you're speaking with them, you're not there to give them advice or give them even solutions for that matter. That may be something that they need to bring on someone else, a different role to help us, solve. But you're there to listen and to provide hope and some guidance if they need it for that immediate moment. But ultimately, they need to call on other people for something that's bigger and a bigger an issue. We don't definitely want to create any false hope. So for example, people will share their medical situations with you, and that may not necessarily always be getting better. So in that case, we want to ensure that we don't offer any type of false hope or some kind of therapy we know exists or alternative medicines, because that may, just get moving down the wrong route, and that's not going to bring any help to them. Ultimately, we don't want to be dishonest or artificial. So for example, if you're speaking, people can tell if you're being genuine, right? If you actually care and if you're actually showing how you feel, you don't want to make them feel that you're judging them or you're actually just being, fake. So genuine care, genuine attitude is really important. People can notice that, and it takes time to form the trust and the friendship that we're really we're hoping that this creates. So this story and this ability for them to share with you will translate into their stories. So if you create that atmosphere of trust and that ability to speak openly, they will really appreciate and respond accordingly. Don't want to be judgmental. Definitely keep an open mind. The mind is like a parachute. It only works when it's open, right? So I love that quote from Einstein. And one more thing is, when we're speaking to that person. So if I was meeting with Alex right now, and there's another person there who's a caregiver to Alex, Alex is in front of me. I'm speaking to Alex. I'm not speaking over here to the caregiver and giving them my attention, right? Because yes, that may discourage that dialogue, right? So definitely we want to ensure that we're speaking directly to that person, and we don't want to whisper to other family members or medical personnel in the presence of that person. And don't talk in front of them as if they weren't there. So that's the key one here. We want to ensure that we're respectful to them. Yes, thank you. And one more thing here is on the don'ts list, because that's a big one. We want to ensure that we don't discuss your own problems or past illnesses. That's nice to know for yourself, but don't bring that into that conversation. We're really here to be and listen to them, and we're being with them. And it's not about you. As much as we sometimes feel, we want to keep our feelings at the door at that point, right? And we don't want to question them about their illnesses. That's not our role. It's not our job. We want to make sure that if they feel they're comfortable, they can tell you things about their illness, but that's not the point of why we're here. We're not there to diagnose or help or alleviate for them to feel better about their own illnesses. If you have not been told what their actual medical illness is, it's usually best not to ask. Okay. And if he or she wants you to know, they will tell you. Simply listening and listening carefully. If they criticize doctors or nurses, institutions, or family members, that's something you want to pay attention to for your own self, but don't rely on that as being something that, you need to actually assess and actually solve in any way. So, and a person, if they don't want to discuss something or if they don't want to talk even, you can actually offer companionship through silence. So that's where if you have a phone, these are actually really helpful to have like a playlist or some type of music or poetry. If they have a certain type of genre that they prefer of music, or even poets that they use in the past they've read, they love, you can actually speak to them, or you can read to them. You can share that, third, tool with them, which is really helpful. Or an iPad, for example, or bring out those books that you feel that they would really appreciate seeing. For example, an album or a book of theirs, if they'd like you to. When we're speaking, for example, we don't want to speak in a natural tone of voice. So I was sharing with someone the other day, and they said I was really high energy, and it was actually affecting the Zoom call. So the Zoom was shutting down because I was getting higher and higher. So if that happens, they'll respond and they'll tell you, and you don't want that. You don't want them to be affected negatively. So a natural tone of voice is really key here, and even neutral tone is important. If you're speaking to an adult, you want to show respect to them and make sure that you don't feel or make them feel like a child. And that's really key here. Like speaking to them where they're at that, in that place is really important, and not, placing them in a different place. Don't speak too loud. So if I'm too loud, let me know. You can actually say that at the beginning, and say, please let me know if you can hear me. And that way, how their comfort level is. Don't pointing at, especially here, loud noises can be irritating in the background. So if something is bothering them, make sure you solve that first, because there could be a situation where they may not hear you properly, or something else is bothering them, it's irritating them, and you want to resolve that first before you commence the meeting or continue it. When we're speaking to them, we don't want to point out mistakes. That's not our job. We don't want to buy gifts. So you can share things when you bring them, but you don't want to leave them there and insinuate that you're offering them gifts. Also, you don't want to accept gifts. Now, this is a key one, and I think Alex has really hit this on the head when he talks about it. He says, unless it's a close friend, and if there's an exception to that rule and you really know them for a long time, you can actually do that. But we're not there to accept gifts. That's a real big no-no. So oftentimes we'll find people want to give you something because they want to show you how much your visit means to them. But that's not what we're there for, because that's going to start to insinuate that, in order to come, they need to be paid off, or that person needs to be receiving something, and that's not nice. So we don't want to make that connection in their mind, and we would say, thank you so much. This is so kind of you to offer this, but I'm sorry, I can't accept anything from you, because this really is not why I'm here. I'm here to be with you and to learn and share about your memories, and to help you, with speaking about your past, if you want to do the my story, or however you want to place that. Okay, so just don't accept gifts, please. And when we're speaking to them and we're ending the visit and we're concluding that time with them, some people have good days, others bad days, and we want to adjust the visit accordingly. Everyone has different days. Sometimes people, they want to end in a prayer. I love praying with people. And, it may just be spontaneous and they decide they want to pray first. Wonderful. If they do want to pray, but they don't know what to say, you can bring on a prayer book, or, for example, just start praying prayers that prayer requests are really key here, and they really bring a great comfort to the person. So we want to ensure that that's part of it if that's what they want. And also, if the visit is short versus long, that's good. Short and sweet, as they say, is always nicer than long and uncomfortable. And definitely planning your next visit. If you, before you plan your next visit, you want to ensure that you have your schedule and you have their availability, and you ensure that it coincides together, and you plan accordingly. You make sure you note that date and the time so that you have that saved. Also, you want to thank them for their visit, and making sure that you have that appreciation, that they know how important that time has been for them to spend, that you've spent with them, because it's important for you, not just for them.
So I was going to make a comment because about prayer. Now, because this is essentially, most of the people involved in this training are part of the Catholic Women's League, prayer might become something that's just a normal thing that you do with someone during a visit. But obviously, this is voluntary. But if you're visiting someone who's not a member of the Catholic Women's League or not a member of the church, you have to be very careful with this today. I'm just saying that not because I don't think prayer is important. I think prayer is very important, but that's not the point. The point of it is some people are very uncomfortable with that, and we know that. So as I say, if you're visiting a Catholic Women's League lady who you've known for many years, but now has certain health difficulties, or is because of her age, she's unable to join you anymore in your meetings, etc., she might be really wanting to end your meeting in a prayer, and that would be totally appropriate. But somebody else might think, nah, not interested, and that's obviously the reality. So
yes, exactly, that's right. Thank you so much for that. Alex. And after the visit, this is really key here. I would definitely encourage you to keep a journal. And I have so many journals. I would love for us, we have a journal for this, with that, for family, for business, for whatnot. And so after the visit, you keep a separate journal for only your visits. And that's important. Why? Because after the visit, you may actually have the best, and you do often have the freshest memory of what happened. And sometimes you may want to write notes for yourself to prompt you for your next visit. So for example, if you discussed a certain music genre that they liked, or a movie or a song, you can actually write that in your notes. And next time you prepare, you bring something with you, along with you, that will help encourage them or even share that with them. You want to definitely also keep a main point of that visit. For example, if they share any private information with you, this one is key. For example, if they've given you kind of information about something in the past, an abuse, something that happened to them, you definitely want to keep that very private. That's only for your eyes. The journal is just for yourself. But this is key because you may not remember this on the second or later visit. And yet this is something that's going to connect them, come up for them again in the next meeting or the next visit. So for example, if they had anything, that happened to them in the past, you may want to note that down just for your own information. And that way you can actually connect that when that happens again, if it happens again. But just to note here as well, especially, that this is super private information. This is highly confidential information. No one else can know this. This is, in a sense, almost like a legal document for yourself, and you are not able to share that with anyone else, okay, including their family, their relatives, anyone, their care team, or medical professionals. This is not for anyone else's eyes. This is simply for your information about that visit, and this is completely confidential. So I just want to underline that and score that here, that's important to note. But it is important for you, maybe, because that will help you, remind you of what they were sharing with you last time, so you're not caught off guard again, okay? Does that make sense? Great. I see some head nodding, so that's good. And so thank you. In terms of evaluating, you can actually evaluate your visit to determine how it can be improved upon. And what's key here is thinking of opportunities that you can actually provide life enrichment or opportunities in meeting enrichment. When you speak with them next, you can actually bring up things. For example, you may want to arrange for a barber visit or a beauty visit. Maybe they want to get their nails done, okay, or whichever. A pet therapy visit or service dogs, perhaps, if that's the case, they may want to encourage that as well for themselves, but they don't have that ability to do it. There's the day that you say you want to do something, and there's the day that you do it. So you may be that day, and you may be that person that actually does it for them. And that's really amazing, because that'll be so beautiful for them to have that ability to do something that they really want to do, but they just can't set up for themselves, or they aren't able to. Music therapy is another big one. You can arrange something like that. If you know someone who plays an instrument, maybe you can actually bring that person, or actually have that part of your meeting, if it's an opportunity in their center or in their home, wherever they live. And think of these opportunities, because it's so special. Something so small for us can be so huge for someone who hasn't met with someone for a week or 2 weeks, or even this whole, time during COVID. So, and if you have any kind of concerns, speak to your supervisors for CWL. You want to speak to whoever is spearheading your group, or whoever's in charge of that, and that visitation, making sure that they know of anything that's happening that's different, or that's not, that's more uncommon, or something that's affected you that you think might be in a situation of abuse even, or neglect, because that could come up as well, potentially. And if you need any other further information, for example, for us, for Alex, for Genevieve, you can call the CCC helpline. There's a number here listed. And also you can call, that helpline is available 24/7. You can connect with someone. Also, you can connect with the office and leave a voicemail, and they'll call you back on there. And definitely, if you have questions, you can always reach out to the office, to Genevieve, to Alex, and they can help you with those visits and those ideas, and also any kind of issues that may arise. Thank you so much.
There was actually a question in the, so you might want to deal with that right now, the one that was in the chat.
Yeah.
I have questions regarding validating their feelings and their emotions as written in the handbook. So, obviously the issue of validating, okay, there's another thing coming up now, so that's fine too. What we'll do is we will take questions at the end also. Yeah, here's my question. So I don't forget it. I question the suggestion of saying, I understand how you may feel. Any other recommendation regarding working with people have discouraged claiming, I know how another person feels. Yeah, I don't really know how you feel. You're absolutely right. I don't know how you feel. I am a different human being. I agree. Unless I have similar experiences, I don't really know how they feel. I agree with you. That's absolutely correct. In the case of validating, yeah, we're not trying to see I think the whole argument though is that in this thing is, how can I get the booklet printed, Maria? Well, you can print it from your printer, or we can send you one, and there's now the booklet with it, and we'll have questions about that to deal with at the end. These booklets, we only charge $20 for it, so we're not charging a lot of money. We're not trying to make it a situation where, oh, I can't afford that. We're not trying to do that at all. Anyway, the issue of feelings are that we're not actually wanting to argue with someone. We're not trying to tell someone they're wrong. We're not trying to go into those situations. What we're trying to do is create a relationship, and that's what we're doing with these situations. Now, the My Story, actually, I've been suggesting to different groups, such as the Catholic Women's League, the My Story does two things. So here's an interview workbook for My Story, and we have created some questions that are more specific to what a Catholic Women's League organization might want, right? Because this is more basic. The booklet is designed more basic. But the idea comes from the fact that if you look at a lot of research, people who are questioning their value of life, their purpose, they've gone through, they've experienced their life, and they might be now experiencing depression or things like that. But the big thing about My Story is it's validating that person. When you're asking about them, what's important to them, it's validating them. So what we're doing is we're dealing with people who might be going through depression. They're feeling loneliness. There's the whole issue of their self-esteem, social isolation. You see, when you have this sort of loneliness, often the loneliness leads to depression. Someone is feeling that their life has lost purpose or value. They're really starting to question, why am I here? And you might speak to, for instance, you might hear a priest or a sister who's done a lot of visiting say, it's not that uncommon for someone to say, why am I still here? Are they saying they want to die? No, what they're saying is they're really looking at this saying, why am I still here? They're going through this existential questioning, and we recognize that that's a normal human feeling. The purpose of the My Story then is that we go and we talk to people. Now, in the case of the Catholic Women's League or other groups like that, I'm viewing the issue of the My Story as an opportunity. This is an opportunity to get in and speak to people, because what you're doing is you're asking them, do you want to be part of our Catholic Women's League My Story? I am encouraged, for instance, we had training for the Diocese of London, and I was saying to the ladies, this is the opportunity with the 100th anniversary. Now, COVID, we did all that training in January with the ladies in the Diocese of London, and then we had another, the third wave of COVID, so they couldn't do visiting anyway. Now, some of them did do the My Story by phone and things like that. But I said to them, well, you have a lot of older ladies who have been your leaders in the past. They have served the Catholic Women's League. They have a history with the Catholic Women's League. And some of them are now living alone. Some of them are living in nursing homes. Quite a few of them might be living in their homes still, but they're not as active, obviously, not because they wouldn't want to be, but because they can't be. Their life has changed. So, you're creating, their story is your story. Right? Their story is your story. But what we're also doing with the My Story then is we're affirming them. We're asking about them. So the studies show that when you go visit somebody and you want to know about them, now, of course, this is voluntary. Someone has to be willing to participate in that. When you're asking about them, that creates this whole issue of making them feel that their life was important, that their life had value. They are gaining their own feelings of, yes, I know I did great things in my life. You're affirming them at a time when they're having a hard time affirming themselves. And this is what's very important with the My Story. We're dealing with all these issues of, and the problem with the My Story is that you're dealing with somebody and you're going to help them through the whole thing. If they've agreed to be part of it, they're going to get into some real issues in their life. And so a lot of this is about listening. But the point of it is that we're helping them rediscover the importance of their own life, but we're doing so in a way that is of very interest to them. And at the same time, if it's in the case of the Catholic Women's League, and we're creating our own My Story for the league, for instance, for the Archdiocese of Edmonton, etc., what we'd be doing then is we'd be affirming them and affirming our own history. I think our history is important. I think it's very important. So in the My Story, they recall events, feelings, key topics, right? They're sharing their memories. These are positive things for some people. Obviously, there's negative memories for a lot of people. It's a form of healing for the person. So when you're talking to someone and you're asking them about them, they might bring up issues that were very painful for them. And you know, we're not here to be psychiatrists or psychologists or anything like that. We're not. We are listening. We're trying to be a friend and caring. So if these kind of issues come up, obviously we're listening. And it's an opportunity for them to talk about it, and they might find healing in it. It improves their cognitive function. You know, when we talk about people who are starting to lose their memory, but you ask about their past, and they start, you know, they almost jump from one situation to another to another. They'll say, well, you know, when I was younger, and then this happened, right? And so they're talking about these things, that memories are coming through. It's helping their cognitive function. It's helping them remember their past. And as I said, a lot of people might have some issues with memory, but you ask them about their past, and they've got certain very clear memories of their past, and that's important. They have an important place in the world. We're affirming them. Okay, we're affirming them by having them tell us about themselves. It's a very important thing to be doing, and it's very practical. It's very practical, the My Story. It's helping them come up with these issues. It's a very practical thing. So when you're reviewing one's life and you're writing down their story, there's many benefits to this. Okay, there's benefits for the person. There's benefits for the league. There's benefits if you're doing it through the league. That is, if you might it might be just your parish. Your parish might say, well, why don't we make this a parish thing? We have quite a few older members. You know, let's be brutally honest. In the Catholic Church, we have quite a few older members, and some of them, as you know, they are, how would you say, if they're not the backbone of the church today, they were certainly the backbone of the church just a few years ago. And many of these people are alive, and their stories are important to us. And the fact that we're asking to tell their story, that's important to them. That's important to them. We're making their life important. Seniors are at a much higher risk of suicide. Sadly, we know this is true. It's not just a data issue. I don't know if suicide has been an issue amongst any of your communities. I don't know that. We know certainly that it's more prevalent in certain communities than others in Canada. Nonetheless, men aged 85 to 89 have the highest rate of suicide than any other group. So that's just a stat, but I mean, it affects us because we know it's a reality. We have the legalization of euthanasia now. So when you create these relationships with someone and you're asking about their story, and what's happening is they're bonding with you, things like this start coming up. I'll give you an example. The one woman who I knew quite well a few years ago, she was involved in a lot of Catholic issues and things like that. She was living in British Columbia when she first got married, and she decided that she had Fridays off of work, and so she would go visiting a nursing home near her every Friday, and she ended up meeting a few of these ladies there. So every Friday she would meet with a few ladies, and that's what she was doing on her Fridays. And the one woman was listening to the news, and the issue of euthanasia was coming up. So this is a few years ago, and the woman said to her, well, you know, if things got pretty rough for me, I think I might consider that. And so the young woman who I knew responded by saying, oh, that would be a terrible idea. And the woman said, well, why is that? And she says, well, I look forward to seeing you every Friday. And if you died by euthanasia, I wouldn't be able to come visit you. And the woman said, are you serious? And she said, absolutely. I look forward to seeing you every Friday. Anyway, the woman said, I think you're right. Euthanasia wouldn't be a good idea then. It's funny how just that relationship on a Friday was enough. Okay. And the other thing, of course, meeting with someone does is what you're obviously getting in this material is someone who, let's say, lives in a nursing home, or maybe they have no one ever visiting them. They might get a few phone calls here and there from their daughter or their son who lives in wherever they live, or some other friend every once in a while calls them, but they're living quite a lonely life. that in fact they look forward to you coming. If you're saying, oh, I'm coming Wednesday afternoon at 2 o'clock, I guarantee you they are looking forward to Wednesday afternoon at 2 o'clock. Okay. And if you can't visit them and you can only phone them, they're still looking forward to that phone call Wednesday afternoon at 2 o'clock. So you're helping them find a purpose to live. Participation in the My Story program will significantly lower depression. Why? Because you're asking them about them. They're spending time thinking about it. When the meeting's done, like obviously speaking, you don't sit through hours and hours going through the My Story. You're coming to see them once every week or once every second week or whatever it might work out to be, right? It might vary, obviously. And so you're seeing them several times and you're going through these different questions and talking to them about their younger life, their married life, whatever that might be, right? And it's sort of a process. What they're thinking about it. It's part of what they're doing now. They're thinking about their past. They're looking forward to seeing you, and then they can say, well, you know, this is important. Now, my mom got involved with this in Woodstock, Ontario, and she was talking to different people who she knew who were, you know, quite. My mom's 81, but I mean, you know, other ladies she knows, and my mom's quite active. Other ladies she knows aren't as active anymore, so therefore she was talking to them. And the one lady was talking about her marriage as had been a very abusive marriage. Now she ended up leaving her husband and everything. But my mom had no idea about all this, but she was wanting to share this and everything. Now, my mom's a very caring woman, and she's one of these people he would say, you know, that's a really, you know, sort of a kind person, my mom. She's sort of active in that way. And anyway, my mom, you know, was talking to me. So there was hopefully, just talking about it, there was hopefully some healing for that woman. The ability to care for others, you know, guiding the next generation. It's all part of the My Story. We're talking about our past, which leads to our future. We're assuring someone that their life has meaning, and it has meaning also to others. And My Story helps us to connect to the past. You know, the fact of it is if we have a future, it's because we understand our past and we're moving into a future. Not knowing our past is not good for our future. I guarantee you, as a church or as a culture, we need to be interconnected. Loneliness is also a psychological state. We've already gone through that if you saw the video at the beginning, that'll explain that there's a risk of early death. Loneliness leads to depression. My Story eases these issues. It eases them. Why? Because someone is thinking about something else. They're involved in doing this. They're caring about the fact that somebody's interested in them. It helps them feel better about themselves. And conversation combats loneliness. The nicest thing about the My Story is when you want to set up meetings with somebody, and they're, let's say, with your Catholic Women's League, and they're an older person who you may not know as well, but you knew of them and that sort of thing, you know, and you contact them and you tell them, well, we're doing this project and this is what it is. Would you like to participate? They may say in the end, I don't want it published, and that's fair. But I mean, if the door is opening because you're actually doing something, right? You're doing something to interview them. It opens your door. The My Story promotes and reinforces a person's place in society, and it encourages and acknowledges them. And reminiscing is very important. It's very important for them, but it's very important for, as I say, for one's cognitive ability, but also it's important for how we feel about ourselves, right? And this is what we're trying to do. It's not about me. It's about the person who we are speaking to. It helps a person reconcile in their past. And it fulfills a psychological need. Your stories are important, and you are important, because that's what we're saying to them. Your story is important. You are important. And a lot of people don't feel like that anymore. Not because of any other reason that, you know, it appears that way because no one seems to care about them anymore. I mentioned that the culture has shifted. Well, you know that, and we know that. You know, how many of you have children who live far away from you? Probably most of you have family that lives far away from you. And so therefore, in the past, when we tended to have, you might have had some movement, but I mean, we tended to be more cohesive in our family units, etc. We also had tighter community. I talk about the fact that I grew up in Woodstock, Ontario. Don't hold that against me. But I grew up in the old part of town of Woodstock, and a lot of our neighbors were older neighbors. And when I grew up, in fact, the one couple did move, but other than that, almost all of the neighbors were there throughout my whole childhood. There wasn't movement. You know, they were there, they raised their families there, And for most of them, they were now older. There was a couple younger families still around us. So that was a community. And funny enough, it was a real community because people who know me realize my father died when I was, a teenager. And the community model was very interesting because what happened is this one lady who my mom knew quite well. So my father died. She decided, she said, she said, Mary's going to be very lonely, so I'm just going to move in. She moved in with us. She just plopped and moved in. So, you have people bringing food. You've got people doing this, visiting, calling. She just moved in. She says, I'm going to be with Mary full time until I know Mary's feeling a lot better. And that's what she did. She was just around the house. She was there. I think it went on for, 10 days or something like that. She was there. And this was a sort of a community thing that maybe you wouldn't see anymore ever. But you could see how affirming that was to someone to grow up in that environment. Social relationships are important, and we need social engagement. And isolation is a serious problem for many people. So anyway, we're validating somebody. We're pointing out how special that individual is who's had a lifetime of experiences. And all these experiences are part of the past that we all share, right? We're interconnected as people within our communities. Well, some people have experienced trauma. And so we're not here to be psychiatrists or psychologists or anything like that. In fact, we should always avoid that. But when you're speaking to someone, obviously these issues of trauma, whether we like it or not, are going to come up. Quite a few people have experienced things. We know that in the case of those who are involved in the church, that there has been things that have happened in the past. So that's another sort of sad reality that someone might bump into. But reminiscent therapy really helps to deal with past psychological traumas. We're not here to, as I say, but we're just asking them about questions that I know they may never want to share any of that with us, or as in the case my mother was just talking to the one woman, she just started talking about her past. And as she would say, she just hopes that was some sort of a healing presence. It creates a sense of peace or relief, and it's a healing component, okay? And now we have time for questions. It's actually 1:35. So what I'm actually proposing, as you can tell very clearly, is the My Story becomes something that we are instituting. So the training of visiting is important because, obviously speaking, some of the people we're visiting are going to be people we know. And so it's not going to be difficult. Why do you need training to visit someone you know? Well, in a case, you may not need training to visit somebody you know. But some of these people we don't know that well. But secondly, on top of it, some of these people, because of age or health conditions, have now got cognitive issues going on. They might not be able to hear you well. They might have certain disabilities that have developed over time. And it's important to be aware of that. And it's important to be aware of how we treat someone in these situations. But I'm suggesting clearly that the My Story is a powerful tool, not only to help people, but to help us connect to our past. And that's what I'm urging with the Catholic Women's League. And so if anybody wants to turn off their, to be unmuted and ask a question, I guess I can go to the, if I stop share, then I can see pretty much, and I can't see everyone, but I can see a huge number of people. And if someone wants to ask a question, they can do so, and we're happy to deal with it. We have some time. And then what's going to happen is we're going to take a break, give you time to take lunch, have lunch, not worry about us, and then come back in a half hour. So anyway, there was one thing from Natasha. I find that in the current setting, people might find that our reaching out to them is invasive. And now I agree. That is a very important point. We have so lost this ability to be vulnerable and real. Can you speak to that? Well, the advantage to the My Story is actually now you've set up a program within your Catholic Women's League group or within your parish or within your community group type thing. And so you're actually reaching out with a focus, right? This is what we're focusing. We're working on doing this. So that gives you an in, right? It's not just, because it is uncomfortable for some people. But the other thing is, I'm also suggesting that what you do at first is you're actually reaching out to your fellow CWL ladies or the people in the parish. That's what I'm urging you to do. So not everyone on this call is part of the Archdiocese of Edmonton. I understand that. And so I can't really speak to all that, but everyone has a community that they're part of. So what I'm suggesting that to make this work well is that we're part of this community that we're actually reaching out with. So in the case of it reaching out further than, for instance, the Catholic Women's League. So let's say you're in a parish in Edmonton, as an example, and your priest is saying, well, really, it's great that you're wanting to visit, Mary so-and-so and Jane so-and-so and everything else, because you know them. They've been members of the Catholic Women's League, and you know that they're really quite isolated now. But at the same time, there might be people in the parish, your father saying, well, or maybe the pastoral minister, whoever it is saying, maybe you should also be visiting this person and that person. So you have an in and you're contacting them. Someone might not want to visit with you. You're right. That's true too. They might not want to visit with you. Nothing personal. But for many people, they're going to say, oh, this is a great opportunity to talk to somebody. And maybe you don't have to say anything. Maybe you call someone up and then they talk to you, or you go visit them and they just talk to you. And then what you have to do then, you're practicing the art of listening, because they're wanting to talk and your role is to then listen. For someone else, you might have to carry the conversation, but they might be happy to see you because, as I've already said, sadly, the data shows that there's a lot of people who don't have very many visitors. I'm going to make one other comment. Since the ladies of the Catholic Women's League are part of a faith community, you actually probably have more interaction than a lot of people who have decided not to be part of a faith community anymore. They've left that. And the reason is in a faith community, we do interact. We go to church on Sunday. We might have other things we're doing within that faith community. So we actually are having interaction more so than maybe someone who has left that. For whatever reason that they left it, I'm not here to judge anybody, right? So is there anyone who has questions outside of the chat? Yeah, you should tell them that you're maybe writing down some information in that. And the reason for that, yeah, Jean Ashton has her hand up. But the fact is, from the very beginning, you have to make it very clear that the information, any information they share, is it's their information. It's not your information, it's their information. And someone might say, like, if someone doesn't want to share because they have concerns, absolutely. We're not here to pry into someone's life. That's the last thing we want. We just know it's a reality that when you're talking to somebody, things might happen. There's also in the booklet here for the My Story, there is a permission form. So for them to actually participate in the My Story, now they might participate in the My Story in the end. They might say to you, I don't want it published, or take that out, because everything is their business, right? It's not your business, it's their business, right? But the fact of it is from the very beginning, yes, you have to emphasize that this is their information, not yours, and everything is going to be confidential if anything comes up. We're actually really not trying to encourage it. I'm just saying in the reality, something will come up. Like the reason we talked about disabilities and issues like around talking to someone with disabilities is not because you're going to be meeting with people with disabilities per se, but because you're just meeting people, you will be meeting some people with disabilities. The issue of Alzheimer's dementia, it's not that we're specifically going out to meet with people with Alzheimer's dementia, but if you're actually going out to meet people, some of those people might have dementia, right? It's just a reality. We have to understand that where they're coming from and what's happening in their life. And that's what's important with that. But everything's very confidential. For instance, if someone is a pastor, or in the case of Sister Susan, if she's meeting somebody and she's doing so with the parish, that sort of thing, confidentiality is always of the utmost importance, without a question. It's like primary. Okay, it depends on what you're doing, actually, because if you're actually working with the Catholic Women's League as a sense, and there's an issue, because what this whole thing about speaking to the supervisors about is, let's say there's an issue. Clearly, there seems to be a problem. How do you deal with that? Well, if you're part of X and Y Catholic parish, and you might be visiting on behalf of the Catholic Women's League, but you're part of this parish and you're really visiting people from the parish, even though it's a Catholic Women's League lady. It's important to share that information. We can't, if there's, there's going to be somebody who's the contact person. So as I was mentioning, so let's say the pastoral minister has said, can you contact so-and-so because we know they're shut in, they're someone who could really use someone to talk to them and visit with them, and you do so, and then as you visit it a few times, you see there's clear issues. There should be someone who then brings that up with that person and says, I have a concern. And obviously these are privacy issues, but I mean, if there's some sign of abuse or something, you can't keep abuse private. So how are you going to deal with it properly? These are difficult questions. There's no question about this. So that's what we're talking about. So just for your information, in the UK, the government, so in England, Scotland, Wales, the government has set up a commission on elder loneliness because they recognized in their data that they have a lot of older people who are lonely, and so they've got a whole thing going on there. And so if you're looking for good videos talking about the issue of elder loneliness and all the problems associated with that, the best place you're going to find that is you go to YouTube and you're going to find all these UK videos, and they were all paid for by the UK government. Okay, this one was actually a Channel 4 one in the UK. Nonetheless, I think it's quite good, and it has already like 1.2 million views or something. This video, but it's only 3 minutes and 52 seconds. I think you'll find it quite good, and I'll start it.
If you've never been lonely, you don't realise what it is like.
It feels as though you've been dumped in the deep end and there's nobody there to rescue you.
Well, you go hours and hours, never speak to anybody.
I don't think you'll ever get used to it. It's always loneliness.
How do you measure loneliness when even trying to talk about it takes your breath away?
The room's just empty.
"91-year-old Margaret Nickness has lived in this house virtually her whole life, first with her parents, then her husband and family. 2 years ago her husband died. Now it's just her.
We used to do the garden together, do our shopping together, everything was done together.
But you obviously miss him.
I do.
Margaret's granddaughter takes her shopping and neighbours pop in to check she's okay, but it's everyday company she misses.
Some people would think me a bit odd, but I do chatter to my husband. I do it so I'm sort of, speaking.
That's the wife with a cousin.
Roy Croucher lives a short drive away. He and Margaret have loneliness in common. He lost his only son to cancer and then his wife for 50 years.
I'm always hoping that the wife will come through the door, which she never will. If you go out, you come back, and you come back to an empty house, and it's loneliness again. And you're always waiting for somebody to call.
Roy says he's lucky. A friend and her family see him most weeks. But like Margaret, some days the only voice he'll hear is a call from a phone befriending service run by volunteers.
Julie rings up on a Saturday night, because last Saturday she was the first person I spoke to all day.
And that's a long day.
It is a long day.
And how much difference has that made, that phone call that comes on Saturday night when you haven't spoken to anyone else all day?
Well, I always look forward to it. I always put that phone on that seat, ready to pick it up. And that's a great help.
The campaign to end loneliness says it should now be treated as a public health issue. Identifying the most vulnerable is critical. then offering support to cope with the bewildering and painful reality of ending up alone.
I've never been on my own ever before. No.
And so getting used to that has been hard.
It has. I don't think I shall ever get really used to it.
It's just something that is thrown at you. You know, and you can't you can't throw it back to anybody. You know, you've got to just carry on.
Wonderful.
Going back to Kathy with communicating with people with disabilities.
Thank you so much, Alex. Appreciate that. And so it's great to be back, folks. Thank you so much for joining us. If you feel at any point during this time, and especially the second half session, you want to stretch, get up, move some limbs, you know, feel free to do so. All right. It's a great session. I'm so excited to be talking to you about this part because communicating with people with disabilities is crucial. I feel as though you really want to emphasize that in this part, especially, the ability to communicate effectively and to be taken seriously is important to all of us, obviously, and we both, we know that. And so a person with a disability wants to ensure that they are being understood, but especially that they want to be treated as we all do, which means as an independent person. And so we want to offer assistance if they need it, obviously, if only if they need it, but don't assume that they want assistance. So this is something crucial. When we're talking to someone, a person with a disability will oftentimes communicate when they may need, she or he needs help. And if they do want help, they'll ask you, but oftentimes they may not communicate that. So you can actually ask them ahead and say, would you like some help with this? Or would you like some assistance with bringing this, you know, article closer to them, or food or something, you know, to assist them. People with disabilities are the best judge of what they can and cannot do. So they'll gauge whether or not they'd like to have help with it. And so please don't make decisions for them about participating in an activity. You definitely want to ask first before you start or commence anything, and especially a new activity. And always speak directly to the person. So that means really, if they have a disability, you're not speaking to their, you know, a companion that is with them, or their aide, or an interpreter. If, for example, they have a sign language interpreter, you want to speak directly to them. Like I mentioned, and we spoke about this earlier, if I'm speaking or meeting with Alex, I'm speaking directly to Alex. I'm not going to be speaking to Genevieve if she's his aide or communication partner, unless I have to, obviously, for obvious reasons. But you want to acknowledge both people, but you're speaking directly to the person you're meeting with, because that's who you're meeting with, okay? And if with a disability, you want to avoid any type of negative or disempowering words like a victim or suffering or sufferer, because those are obviously going to negate and negative, you know, make their feelings feel you know, very different than what you want. Ultimately, the effect of your visit is to bring hope, love, obviously compassion, understanding, and just, you know, a hopeful tone. So definitely be sensitive about what words you choose. Also be sensitive about the physical contact that you engage in. So for example, when you touch someone, if they allow you to, or if they, you know, go to move towards you and they put your hand on top of your hand, you want to welcome that, but don't go overboard. You know, don't reach for the arm, start stroking or something that may make them uncomfortable, because that could make anyone uncomfortable. And definitely be sensitive about the environment. So if it's a louder environment, if you're in an atrium where there's a lot of noise, or they're starting a band or some type of music, then you definitely want to maybe reassure them, let's maybe move over somewhere quieter, somewhere that's more peaceful, that you can concentrate better and they can hear you. And wherever you are, whatever you're doing, this is the best point here, which is, you know, the commandment that we've heard so often, which is the golden rule: be a friend and follow this. Do unto others as you would have them do unto you, right? And we all know that, and we all appreciate it, because that's so true. Any type of situation we're in, we want to ensure that we are respecting them. on the spectrum, when you're speaking to someone who may have autism, it's a spectrum. So first and foremost, we want to ensure that we understand this. There are people who are on varying degrees of the spectrum, on the spectrum. And so we want to avoid, for example, certain language too, because there's certain things to keep in mind. If you're speaking to someone and you say something that you think is funny, and you may be hilarious, but with someone who may have a disability, especially with autism, perhaps, they might not understand. And that's going to impact the relationship or that conversation, because they won't engage with you the way that you assume they would if you're speaking with someone who may understand that sarcasm or that humor that you're using. Certain figures of speech, for example, colloquialisms, you might say, for example, to someone, if you're walking outside, and you say, a certain phrase that you think is understandable, but they may not receive it that way, and they may not understand. I know, and I remember a fellow I spoke with once, and I said, why don't we bag it and take it to go? And he didn't really understand what that meant. So really, it was something very simple, a routine you would hear all the time, but he didn't understand. Or, for example, just different things that you want to engage them. Try to transfer that type of language into very common, very simple, very straightforward phrases, because that will make it very easy for them to recognize what you're referring to, and it's cognitively easier for them potentially to understand that. Also, using short, simple phrases and sentences with closed quotations or closed questions would be really good. What I mean by that, I mean simply saying, would you like to go for a walk? Would you like to go pick, a book, and we could read some of your story, for example, or we can actually go over some of your story. Anything around those types of simple phrases will help to aid that person to understand exactly what you're saying and what you want to relate to them. Be aware also of your body language. When you want to speak to someone, you might be saying that you want to stay in one place, but your body language is fidgety. And, you might be relaying to them that you're very busy and you want to keep going, or you're looking at your phone perhaps, or something is on your mind. So definitely be aware of your body language and their body language too, to ensure that you're in the same rhythm, that you're in the same mode, and definitely in the same frequency of understanding where they want to be or they want to land with where you're going to go. In terms of words, you want to use flexible words. So for example, we may go to the atrium today, or we may not. Instead of just simply saying we're not going to the atrium, because that's it's a very finite language and a difference of tone as well that will distinguish. So we might be visiting someone else today. If it's an elderly person, for example, you want to ensure, sometimes we are speaking to someone who has had a stroke, and they might have similar symptoms or similar mannerisms as a person who, for example, has autism, or a child with autism. And that's, we tend to try to kind of understand that, and just making sure we don't receive them or simply speak to them in a way that we would to a child. Even though they may have a different cognitive ability, we want to ensure we meet them at where they are, but especially speaking to them in a very respectful tone, as they are adults, and we would want to be spoken to that way as well, okay? With someone who has, for example, a chronic medical condition, we may not know that a person has that medical condition, and we won't need to communicate any differently. So definitely you want to ensure that regardless if you know their status medically or not, if a person is not showing you or telling you what their condition is, respect that. That's their privacy, and that's only for their information. They're not needing to inform us this. And so if something, for example, develops and they're showing signs of distress or being unwell, definitely remain calm, even-toned, and especially not hurried, because you will accelerate them as well and start to make, maybe it's stressful for them and causing distress for them if you are starting to respond very much in a faster, more kind of complicated way or manner. If they happen to get into a place where they need help, definitely access the support. Ask them if first they need any help. If they need you to help them or someone else, then pull in those members of that community if you need that or you require it, and help them to access that support, but definitely tell them what you're doing first. So this is key. We always want to inform the person first and ask their permission in order to engage any type of other person or a member that we may need to call on. All right, that's really key. And then, of course, when we are speaking with someone who has for example, hearing difficulty, we want to let them know that if you are having trouble hearing them or understanding them, that you want to tell them that. So definitely translate and inform them, I can't really hear you. I don't understand what you're saying. If you're meaning this, or you can simply say, if you can't hear them, you want to say that you're having a difficulty in actually hearing them. So you may want to go to a quieter room. If there's an issue with, for example, speaking to them and they have an interpreter, make sure you maintain eye contact with the person who has, who may be, hard of hearing, but also the person who's speaking to you. So through that, and ensure that you're always maintaining your emphasis and your attention on the person you're meeting with, okay? Definitely rephrasing is important here. If you have an issue with someone hearing, I often find this is the case with my father. Again, I'm going to bring my dad into this conversation because he's a phenomenal person and he's so dynamic. But one of the things is he likes to talk like this, and he speaks in a very shallow tone. And some people can't hear him or understand him. And in the same way, he can't hear most of other people speaking. So when my husband speaks, he can barely hear him. And oftentimes I find I have to overemphasize words that my husband says so my father can hear or understand. So there's like a two-way street. And that can happen too when you're meeting with someone. So you're kind of like the middle person, but you're also the one who's managing the conversation and the communication. So you really are in charge on that sense. And it's important to be always understanding for if the person, if they don't understand something you're saying, you'll notice that, right? They may lose attention, or they may find that their eyes are starting to, their eye contact starts to waver. So you want to bring them back into the question and actually ask them, can you hear me all right? Or did you understand what I meant? And definitely rephrasing that is important. When you're speaking to, you want to make sure you're facing the person. You don't want to sit in front of a light. So right now I have the lights right on me, but if I was against the wall or another surface, that's fine. But if I happen to be in front of a light source like a window, you might actually see that you are in creating a glare behind you. So that may obscure your face and make it difficult for the person who is hard of hearing to actually speech read. So definitely to stay away from things like a light source or a window that may interfere with that communication or even hearing. In terms of speaking, definitely we want to sit at their level, we want to speak clearly, and we want to ensure that anyone who has hearing loss, they can actually count on people's lips, watching and reading your lips. So when you speak, make sure that they can understand you by speaking clearly. Avoid chewing gum or eating food if you're not eating or don't need to, or obscuring your mouth with your hand or another object while speaking. Finally, also, when we're speaking with someone who may have a learning disability, we want to ensure, again, we're using short, clear, very direct sentences. Older people may have acquired, have acquired a learning disability as they age. So that can come up when you're meeting with them and you want to be able to show them things. So sometimes I like to bring, like I said, even a larger phone or something that's bigger, maybe an iPad if you happen to have one, or another tool like a book, something that will help you in, showing them what you're referring to. The My book is fantastic because you can actually, bring that up close. That's a great tool and to use that as well. And definitely while you're doing that, you want to rephrase your information. If they're asking you for a cup of water, you can actually clarify, do you want water, do you want juice, whichever they choose and however they want it. And also you want to consider using other aids. Like I mentioned, books are great. Music is fantastic, and writing especially. And I think, when you're speaking with someone who has a learning disability, writing out something in clear, bold, letters is actually very beneficial and helpful because they can see what you're referring to. They can read it clearly, especially if you can write in bigger font and size, and they will understand and actually point if that's what they're referring to, which is very helpful for both of you. And then definitely want to provide an opportunity to answer any questions. So ask them, keep going to actually reach what you want, to understand. You have to ask questions. So have them answer those for you. Thank you. Now, when we're speaking with someone or meeting with them with a mental illness, our next slide. Yes, please.
So I was going to comment on this. It's not that we're specifically going out to meet people who have mental illness, but obviously when you're visiting, there might be somebody who has over time had issues and has acquired issues that have acquired a disability or things that are similar to a mental illness, or maybe they have a mental illness. And so this is just a reality that when you're meeting with people, obviously you need to know that someone might have a mental, in the same way with someone with learning disabilities, that might actually be more common because someone might have had a stroke.
Yes.
And so they didn't have a learning disability in their full life, but as they got older, they have acquired this. But in the case of mental illness, you know, you might be talking to someone and they have issues, and as they've gotten older with, you know, a lot of loneliness and depression, it's become more apparent, you could say. Anyway, I'm just saying that because I say this is not specifically about visiting people with mental illness, but you just might, it might become a reality, right?
Absolutely. Yes. And it's very helpful to know that. And it's true because we're not looking for those people. We're just simply encountering those necessarily because it happens. It can happen so easily. And with a person with a mental illness, often you may not know that this individual has a mental illness. So you won't need to communicate very, in a different way. You the person may show signs of agitation or anxiety, panic or fear, disorientation or aggressiveness. So definitely always remain calm in those situations and ensure that you make time and allow the person to speak. Because again, that's something that may be flaring up for someone. Some kind of situation, again, they may be uncomfortable or something just happened and that may have stirred them to react in a certain way. But it's up to us and ensure that we are very calm level and very much even toned when we're speaking and responding to that. Allow them to speak, show empathy when they're speaking. Giving them that opportunity to say what's happening or even to share is really key here, because what may happen is you can show empathy without necessarily agreeing with what is being said. And this is key. So, for example, we can say, we mentioned this before as well, we can understand that you are feeling, anxious or upset or uncertain about this or that. And that's fine because you're acknowledging their feelings. Sometimes, their reality is their own, right? And we know that. So for example, if someone has a hallucination, perhaps, and it's part of their mental illness, you may not be aware of it, but they are experiencing something very real to them. Or for example, a delusion that may actually appear to them in their, minds or in their circumstance in that moment. And that feels real to them with that disability. However, we don't want to pretend that these hallucinations or delusions are real for us. So we definitely want to make that kind of connection there, is that their reality is their own. We respond accordingly, but we don't want to acknowledge that we see the same things or we hear necessarily those same things. So we want to acknowledge them, but accept that their reality is their own. Definitely coming back to this point here, using short, clear sentences is very important here, making sure we come back to, a place where they're comfortable and safe and they feel welcomed and accepted is important. But definitely bringing it back to a simple place where we can use those simple kind of clear tools. Is very key. Also, if you need to, definitely use, the opportunity to, assist. If someone is assisting that person, ask them to access support if you need it. If you definitely need that help, take ownership of the situation and ask someone for their assistance. And then definitely tell the person you're meeting with what you're doing, because you want to make sure that they're comfortable with you bringing in the second or third person. And so, and inform them of that ahead of time. That's very, very respectful. When we're moving to, for example, an issue, perhaps someone who has a mobility issue, when they, have an issue related to their mobility, we want to ensure that if they have a respiratory or a heart condition, they may have trouble walking long distances or even just keeping up the pace and walking quickly. So that's something where we can adjust and we can be responsive and say, oh, let's slow down, let's have a seat, because you can notice in them, if they can't handle walking quickly, then we definitely need to slow ourselves down with them and make sure they're comfortable. Like I said, bringing up a point of my father, my dad, I often say, hey, let's go for a walk with the kids. And then he'll say, how about we just sit here? He's just fine staying put where he is. And then again, that's fine. We have an understanding, definitely you'll have that also that information when you start to meet with someone. What is their comfort level? Where would they prefer to be? Would they like to be out and mobile or moving around, or do they prefer staying stationary? If they happen to have a wheelchair and they use a wheelchair, we're always going to be referring to that wheelchair in a positive manner. Again, that's part of who they are. If they rely on that, that enables them to walk and move around. So we definitely want to refer to it as, for example, saying a person who uses a wheelchair rather than confined to a wheelchair or wheelchair bound. Again, that language is key here. And we want to stress that this is a wheelchair that a person who uses a wheelchair, that wheelchair is what enables that person to get around and move around. So it's like, you having a car, if you're not able to use your car, you're going to be fairly upset, right? And that car enables you to move from A to B. So you definitely want to underscore this, that is a part of the person. We refer to that in a positive tone, and we make sure that we acknowledge it's a liberating, not a confining, aid or tool. So that's really important here. And of course, when we're sitting or meeting with a person, we're going to sit at their level. We sit in front or beside, or however it's best positioning yourself. And, you want to grab your own chair. So if they are happening to be in a wheelchair, you want to grab your own chair, sit at their level. Okay, you don't want to be standing or being above them, raised away from them. If you can't, and for example, it's not possible to sit at a slight distance so that they aren't straining their neck to make eye contact with you, you want to ensure that you adjust yourself accordingly, right? Always take that initiative. And so, definitely be aware of a person's reach limits. Because, for example, if someone has a problem with their arm, or if they've had a stroke perhaps, and they're not able to move themselves as much or as freely as they would otherwise, you can actually assist them and bring things that they need closer to them. So definitely take that initiative there. That's a great thing to do. And place as many items as possible within their grasp so they can actually hold things that they need if they need them, their glasses or something else that they perhaps need or reach out to you for. And definitely don't touch, push, handle the person's wheelchair if you don't need to, or if they don't ask you to. It's part of them and their personal space. So you definitely don't want to infringe on that. All right. When we're speaking to people with someone with a speech difficulty, we don't want to assume that they can't understand. We want to progress and move through a conversation and ensure that, they understand you, but definitely be patient. So if they're not responding, then maybe they don't understand or they can't quite hear you. You may want to rephrase or make your tone a little bit louder if you think they can't, but don't assume they can't. Just be patient and ask. We definitely don't want to be interrupting people or finishing their sentences. We want to ask questions that only require short answers. And definitely being attentive here is crucial because you want to make sure that you're really paying attention to how they're behaving to you when you are, involving yourself in a task or an activity with them. Don't pretend to understand them. If you don't, definitely ask them to rephrase or reiterate what they're saying. And of course, you always want to give them your full attention. So this is important. Take that time. You've taken that time out of your schedule to be there. And so just give them that full attention. Don't interrupt with your own business or phone calls if you can avoid it. And definitely, if after trying you still can't understand, and you ask them to write something down, you can suggest another way of facilitating communication so that you can bring in a visual aid or a piece of paper. You can ask them actually write it down, grab a notepad with you when you come. And that way you'll have different ways of communicating. And that's really key here too, because, I think we were speaking the other day and, you were mentioning, Alex, that you had a cousin, right, who happens to be hard of hearing or deaf. And
right.
Yeah.
So this cousin used to come visit us when we were younger, but I've bumped into her quite a few times. And because of the fact is she's a few years older than me, so obviously her way of communicating was pre-computer. She always had a notepad with her everywhere she went. So she would then write down everything and she'd hand it to you and then you'd respond. I bumped into her at a restaurant in London recently, and she still has a notepad with her. And that's what she does. She writes things down and you go back and forth. Now I know she's on Facebook and stuff too, so I could send her a message. But I mean, the fact of it is that's how she communicates. Yeah. She reads lips too, but she just always did this. I remember, as I say, she would have been a teenager, and she's about probably 6 or 7 years older than me. visiting our house, and that's what she did for hours. She just, with notepad, she still does that today, and it's a very effective way for her to communicate.
That's great.
So.
Wow. See, and that's why we're so good that we're talking about this all, because it's really keeping that openness, right? And that's what we want to be, is open, continue to be open to that opportunity. The next point where we're going to speak on is, for me, it's very personal, because a person with a visual difficulty is someone who, may not necessarily see exactly what you're seeing. And so it's a different kind of interaction. My husband, I mentioned this, also has a visual difficulty. And so what happens then is, always when you're entering into that kind of, atmosphere, you want to ensure that you're identifying yourself. You want to ensure that you make physical contact with the person. And especially if they have a guide dog, if they use a dog as well to help them, if you're walking beside them, if we're standing like this, Alex is to my right, and the dog would actually be on his other side. So the opposite side of me. And I want to ensure I position myself accordingly, because you don't ever want to interfere in and then kind of, complicate that side where the dog is as well. So definitely walk on the opposite side of the dog, and don't touch the dog. Okay, the dog is not for anything else other than to assist that person. So don't really engage the dog, and that's not his role. So that's okay. And as you're walking, definitely describe things. If you find there's something beautiful you want to encourage them to know about, you can actually describe it. And I tend to do this quite a bit as well with even my own husband. We're walking outside and I see like an old classic automobile driving by, and I say, hey, this is a great car, just driving by. You would love it. Or a sunset, something like that, simple, but it's beautiful. And they really like being involved in that, because they can actually emphasize and notice it as well. And they like it because they can test their vision ability as well and see, oh yeah, I can see that. I can see the colors, it's actually very nice. It's very warm. Describing a setting, noting any obstacles. This is also important. You may notice a crack on the surface of walking, and you may just avoid it quickly. But someone who has a visual disability or a visual difficulty may not notice that same thing. So definitely allowing them to know that. Avoiding any kind of issue or conflict is key here. And especially, for example, if you're walking upstairs, up or down, mentioning, oh, we're just going to take a step up here. That's great. Or, something that could be in their way is key as well. Okay. Also, one thing, and I noticed this from my own experience, sometimes when you have a person with a visual disability, or, a glass, which is clear, you'll find that you can see it because it shines. But with someone with a visual disability, if it's against a wall, for example, hidden, so let's say it's a cracked glass or something, we had this play out a week ago where someone left a glass with a crack. It was a sharp, jagged point beside where you pump the soap. And so this was in the kitchen. And of course, there was an accident, right? So things like that can be avoided. And so definitely taking that that initiative to avoid something that's a potential harm for a person is really key, especially if you've noticed something and they haven't. You may want to push something like that aside, or make note of it so that they know it's somewhere close by. When we're doing something, definitely describe what you're doing. That's really important. If you're going to be opening something or showcasing something, you want to involve that person, especially, and tell them what you're doing. And definitely, if you're giving directions, you want to give specific non-visual information. So you want to ensure that they understand what you're saying, and things that you can describe to them that they will know about objectively, or they can understand because they are used to it. That would definitely be a big help. When you're having to read something, and I love this because, the book that Alex has given us, the My Story book, has a larger font. If you look at it, right? It has, I believe, a size 14, if that's the case, I think. Yeah. Okay. So that's great. So, it's large enough. Most people will read it. Some people, like my husband, for example, would actually not be able to see that. So they would need a 400-time magnification. So something much larger, something that's enlarged, will be actually helpful to them to actually read that. So offer to read information as much as you need and as much as they would like. If you're serving food, for example, you want to ensure that if a person happens to have, vision difficulty or is blind, let them know where it is on the plate. So, for example, of a clock orientation, you can say to someone, oh, the chicken is actually furthest away from you, it's at 1200 mark, or it's, you know, at the 1200 position, and then your other food is actually in front of you. And if there happens to be something like, you know, garnishes or something that's not edible, you want to take that off, or you want to actually tell them, oh, by the way, if you don't really like parsley so much, let's move that off the plate because you have a big tree of parsley on your plate. So that's really good and it's helpful. And then definitely, you know, if you can provide a larger print size for them to move, you know, let's say sing a song with you or to read along something, definitely do that. Take the initiative and make it larger, because that's going to only aid them and help them as well. Okay.
Yeah,
And
Kathy, like your husband, the president of EPC, Euthanasia Prevention Coalition, Amy Hasbrook, she's legally blind also. She's able to read, but everything has to be super big. Like, I mean, super big. So, you know, our communication is always with super large text.
yes.
But it works because obviously that's she can see the super large text. Anything normal, she can't read that. Yeah.
Yeah, that's great. And it's so helpful, you know, and a lot of times people love reading. It's just the text isn't big enough for them. So we need to help them along with that, right? So that's really great. And if, you know, if you need to leave a person who happens to be blind, and definitely inform them that you are leaving and ask if they need anything before you leave. Sometimes people would like some extra assistance, and maybe moving something to them or putting something in place that they can, you know, need or require soon, shortly thereafter, is very, very helpful. Also, if a person has a low vision or they may need written material in large print, it's easiest to write things in bold letters, white on a black background. So for example, if you look at the book at the front, you'll see on the My Story, there's actually darker background and there's bold white text. And that's really helpful because that helps them to see the contrast. Thank you, Alex. And that's great. And so definitely encouraging you to look at that. And as well, when you're moving through, you want to ensure that you have an appendix. There's actually at the back of the book, you can actually read on these. These are fantastic tools that Alex and Genevieve have prepared. On page 45, Appendix B, Away with Words, is a great guide. Also C, Appendix, which is Complex Communication Needs, on page 69. And then finally, the 10 Commandments. It's a quick, one pager, and it happens to look at the etiquette for communicating with people with disabilities. So all very helpful tools for you to refer to when you look at your book. Thank you.
Advocacy. So we're actually developing an advocacy specific program with Compassionate Community Care. And we've been working on this for a little while. We actually received funding for this. It's not completed yet, but in the future we'll be offering advocacy training. And the reason is very quite clear that a lot of people with disabilities or someone who's quite older, that they find themselves in a difficulty because if they're trying to access medical care, the situation is that the physician or nurse, it's not that they're a terrible person, they don't know them. So they see somebody with, as we would say, comorbidities. They have several health conditions. So someone who's 86 years old and is coming to visit the doctor because they have certain problems and they have multiple health conditions. The doctor's often thinking, what am I going to do about that? You see, doctors are trained to heal. That's how they're trained to be. I know the culture shifting on us and everything, so some of them are becoming a little different than that. Nonetheless, they're trained to heal. But if you have a disability or you have a chronic condition, you're not healing, you're not getting better. What happens is this is just how you live. This is how you are. But what's important about advocacy is you're viewed differently when somebody is with you, right? So if you know that there's somebody in, let's say, a Catholic Women's League lady who you know very well, she's older and she has multiple health issues, and it would be good to be an advocate for that person, if they want you to be, that is, obviously, because they are now then part of a significant community. In the same way as having a son or a daughter go with you to a medical appointment or something is important because you're seen different because you're part of a community. Someone who becomes an advocate, remember, advocacy means you're advocating for that person, but you're representing that person, you're not representing yourself. So you're going to see a lot of this information I'm giving you about this. And it's not for everybody. An advocate has to be, as I say here, Someone might have trouble stating their feelings. They might have trouble explaining their pains or their health conditions. An advocate will help them with that. They'll help, be assertive for them. Someone might have be unable to speak out effectively for themselves. So then you help speak out for them, or they might have a lack of understanding of the situation, or they may be too ill to speak up. So you become an advocate, you're helping them. Often, as I say, people advocate on behalf of their mother or their father and things like that, but we recognize the wider importance of the community of advocacy, as I said, because the culture has shifted, and the physician or the nurse, they're thinking, what do I do for this person? But on top of it, then there's this whole new pressure within our system. It's not now, but I mean, it's become a clear reality of the fact that healthcare is becoming so expensive that physicians are being pressured by the bean counters to keep the costs down. So they might look at someone with comorbidities and think, I'll just give them some analgesics, right? Some painkillers. What does an advocate do? Support a person. You're trying to help that person. You're standing up for their rights, right? You're helping them achieve their needs, okay? You're obtaining and maintaining opportunities for them. So what that means is that if they need special care, if they need to have, if they really should have a referral to a specialist, if they should have a couple of hours a day of home care, you're saying you're knowing this person, you're meeting with this person, and you're helping to represent that person to gain access to supports and services that would exist in the community. And you're talking with the healthcare providers. But remember, everything about this is information about and for that person who you're advocating for. This is completely confidential. If someone agrees that you can be an advocate for them, we have a proposed agreement that could be signed in the booklet, whether that's the agreement you want to use or not. But the fact of it is that this would be a position where you're recognizing this is absolutely confidential, the things you're doing for that person, and can never be talked about with anybody, okay? Absolutely, because you're representing that person. It's the same idea as being a power of attorney for personal care. So let's say you've assigned your best friend that if you had a health problem and you became incapable of making decisions for yourself, that your best friend will make decisions for you. Obviously, in that case, your best friend is making decisions for you when you're unable to make decisions for yourself, is representing you, and you'll be doing the same as an advocate. But this person that you're advocating for is often, in this case, usually still competent, okay? How to be a good advocate? Well, you must be a good communicator. So right off the bat, advocacy is not for everybody. You must ask a lot of questions, right? If the physician is meeting with someone, they don't really know this person, so you start asking questions. Let's say the doctor's talking about A and B, and then you ask questions about, well, for instance, let's say medications. The doctor's suggesting, well, we should prescribe this person with this. Well, maybe a good question to ask is, well, what other drugs is this person receiving? I have a list here of drugs that this person's already receiving. Do any of these drugs contraindicated with what this person's already receiving? It's good to have that discussion. Obviously, a pharmacist should be concerned about that too. You need to be a good listener. You need to be always courteous and respectful. So I always use the word that you have to be willing to speak up, but always be absolutely polite. And the reason is very simple. If the physician or a nurse thinks that you're out of place or that you're pushy, they will instantly say, you're barred. You're not coming around. So your advocacy role is suddenly not any good. You didn't accomplish what you needed to accomplish. You need to be assertive, courteous, respectful, polite at all times, completely polite. But being assertive is important. This person needs you to represent them, okay? Discuss expectations. So you should talk with the person ahead of time. So let's say someone has some chronic pain. Well, chronic pain is a reality. They may not be in a situation where they will be, sorry about that. They may not be in a situation where they're going to be pain-free, but they might be saying, I have certain pain in this part of my body that is really quite difficult to deal with, etc., etc. So we're discussing expectations. Well, what do you think we can do about that? So this is what we're sort of focusing on. Let's discuss expectations. So those expectations then be discussed then with the medical people. You must be have a willingness and comfortable with being an advocate and advocacy. So you know, being shy, you're not going to be a good advocate unless you're just willing to break out of that. You got to do that. You need written permission to be an advocate, okay? And we have a patient advocate agreement. I believe it's page, was it page 43? Was it 43? Yeah. No, that's the police checks. That's
95.
Page 95? Okay. So it's in the booklet anyway, and it's referred to in the booklet. And it's important that you have an agreement. It's Appendix G. That's right, in the booklet. So an advocate talks with the person. So you're representing that person. You're talking with them to find out what they want. You might not even always agree with them, but that's not the point. If what they want is absolutely reasonable, it doesn't matter what you want. You're representing them. You're supporting them, right? It's about them. You're acting on behalf according to their instructions. You're not acting on behalf of your instructions. You're not imposing anything on anybody, okay? A healthcare proxy is a little bit different, again, as I say. In the case of a healthcare proxy, this is similar but different. Usually in the case of a healthcare proxy, you're representing someone who's now incompetent or considered semi-incompetent. So you're representing them because they can't represent themselves anymore. An advocate may be, if you're a healthcare proxy for somebody, you may then also agree to be an advocate for that person, or you may not. Now, with all these issues, such as advocacy and healthcare proxy, I always talk about the fact that you need to have someone who shares your values. So you need to be with someone who you share their values when you're an advocate. And the reason is that if you actually really disagreed with them, I don't think you'd want to be an advocate. I don't think you'd be comfortable with that. But it's the same idea with healthcare proxy. A lot of people say to me, oh, well, you know, I went to the lawyer and I've signed over. So if I become incompetent, my eldest daughter is going to make decisions for me. My first question is, does your eldest daughter share your values? Why is that important? Because your eldest daughter is going to have the power to make decisions about your healthcare when you can't make them for yourself. Same idea with advocacy. It's very important. Before the visit, you need to have the information down. You need to know the time of day. You need to gather information ahead of time. So it says, bring a list of medicines. Why is this important? A lot of older people we've already established are receiving, they have quite a few prescriptions. It's important that if someone has a health problem, that we recognize that this is what someone's receiving already in their prescriptions. This is what they're taking every day or every second day, whatever that might be, whatever the schedule for those pills are. And we don't want to, it's possible that they're actually having a reaction to some drug they're receiving already. It could be that, could be many things, but we don't want to have problems, okay? We gather information. Why are we gathering information also? Well, what are you concerned about? Where do you have pain? What is your problem? We want to be very clear with the physician. We want to be able to describe it with that person, what they are experiencing. We inform the doctor of your role. The doctor should know you have a role, because the doctor's probably wondering, oh, who is this person? Well, it's nice to have a friend with you. Don't get me wrong, it's good. And as I've already said, it's important because the doctor looks at that patient differently if there's somebody with them, because obviously they're part of a community. There's somebody who is important to them. They're part of a significant community. But nonetheless, it's important that the physician know you actually have an important role there. You're not just a daughter or a friend. You are actually an advocate. Be prepared if there's a time delay. So if, let's say, the physician's appointment is at 2 o'clock and the doctor's busy and you don't actually see the doctor at 3, that's probably the reality. And, you know, we've all gone through that. But if you're an advocate, you got to be prepared for that. What do we need to accomplish? Well, what are the person's concerns? This is very clear. You know, you need to take notes. What are their concerns? What are we actually focused on? Maybe we can't be focused on everything at this time. So let's focus on what's important at this time for that person, right? What are the person's medications, side effects, expected outcomes? These are important things. What is the expected outcomes? What do we want to accomplish? We want to be very clear. We're helping the person by discussing it and saying, what do you realistically think we can accomplish in this meeting, okay, with this physician or nurse, etc.? Do they want to discuss new symptoms or concerns? There might be something coming on that they're experiencing. We want to know this ahead of time. How do you talk with the doctor about sensitive issues? Remember, these are private issues. We want to be very clear about this. How do we talk about this? Well, we have to be very much clear that we are representing that person, okay? This is privacy. and I'm representing that person. Your presence may be support enough, meaning you might not say anything during that visit. It's possible that if I'm going in with Teresa Hickey, as an example, Teresa, she's could be fully assertive and polite herself. She's capable of taking care of herself, but she's saying, "Isn't it nice that so and so came with me because it made me feel better to have somebody there?" Right? I felt more confident because somebody was here with me. My presence was support enough. Right? I tell people with disabilities though, and I tell people when they're getting older, don't go to the doctor alone. Just don't do that. And it's not because I have these doctors and nurses are terrible people. Some of them have different values. That's true. It's because they don't know you as you are. They're only seeing you as somebody in need, and they're trying to figure this out. So it's so clear. You might seem like someone that they're thinking, well, what am I going to do? This is the whole point, eh? Keep a notebook, a journal. Now remember, you're talking about private information. This notebook or journal is not actually owned by you at all. When you're taking notes, so let's say someone's meeting with a doctor. Let's say someone has some dementia, right? Dementia becomes common. Someone's, let's say they're 81 years old and they have some dementia. There's nothing new about that, but that means they might have problems remembering what the physician or nurse talked to them about. You're keeping notes, so therefore you can remind them later. This is what Dr. So-and-so said, that you're experiencing this and this, so we should be concerned about this. Now remember, that notebook is not owned by you. You took notes for that person, right? It's not only their private information, it's their information, right? Record particulars, If the doctor is saying A, B, and C, record that. And keep a folder of written responses. It's important that that's a bit of a history to this. You're helping that person with their medical decision making, and can't emphasize this enough. I've been saying it over again. This information is completely confidential, okay? Not everybody's meant to be, an advocate, but if you feel that you can really help somebody and be an advocate, remember what you're getting into. You're getting into helping somebody in a very confidential manner. During the visit, as they take notes, respect that person's privacy, ask questions. Questions are important. So let's say you're representing someone who has a bit of dementia, and that they would not maybe even think about asking questions, or maybe they've wandered a bit, not that they mean to wander, but because of how they are, they've wandered a bit. So that means you're asking questions to the physician to make sure everything's clear, right? You're clarifying, right? Don't be intimidated. That doesn't mean you're not polite, but don't be intimidated. Suggest they provide answers. Talk about this thing. They make these. This is all about questioning, back and forth, is communicating. Inquire about services. So let's say someone has some dementia, again, as I mentioned, and you're thinking, really, so-and-so really should have some home care. They really should have some home care. You've been to their home. You recognize that there's a real need here for a bit of home care. And maybe that requires a doctor's note to have some government assistance providing home care for that person, whether it be 2 hours a day, whether that be, a couple visits a week, whatever that be. It's going to require the doctor to agree. And you can suggest those kind of things if it's necessary. Inquire about the services, ask for information sheets. So if they're saying, someone has some issues with diabetes, or they have some issues with this, or having some concerns with that, ask them for information sheets. They have the information sheets. They can print it off their computer, so they can do these things. And a physician is saying, oh, I can't get to that. Well, usually they're not going to do that anymore. They get someone to print it up, right? They just get someone to do it. Make the follow-up appointments. If you're advocating for someone and the physician's saying, well, we really should see you again in 2 months, you would say, well, let's set that appointment. So you'd be helping that person by making the next appointment with them. Obviously speaking, it's got to fit in their calendar, etc. Fill any prescriptions. So if a physician's said you absolutely need to have this drug, and this is what I'm suggesting as a prescription, that would be filled. Help them fill the prescription is what it should say, but you're part of filling the prescriptions. Discuss the appointment with the person. So discuss that experience of going to the physician, going to whoever it might be who you're providing the care with. And as an advocate, you are invaluable in making the world a better place for those people in need, because you're helping them be seen differently. They're part of it. That person's part of a significant community, and you're helping that person receive the care that they need. Okay? and it's all about them. And this becomes sometimes the whole catch with the whole thing. It's all about that person. So once again, this patient advocacy program, you can see the bones of what we're talking about here. It's in the booklet and everything, but we want to go a bit further with that, with the training, because we recognize that that's a whole area within itself that people should get involved in, especially when we're talking about caring for our own. Advocates Code of Conduct. I want to say something to you very interesting here. I got a contact the other day from a woman whose son is in his 40s, and he has a disability, but he was also had pretty advanced cancer. And the doctors were actually talking about MAID. Now that's why I was called. The family is quite upset about this. The doctors were talking about MAID. And why do the doctors think they have to talk about MAID? Well, they're thinking, well, you know, all the options should be presented. But the family felt that it was being pretty pressured, like they were being pressured towards MAID, and they had no interest in MAID. And this is just like last week. So what happened is that I was communicating with them and everything. I did advise them to have a lawyer send a letter. And so what's happening is this person actually is approaching death. That's true, but they are now receiving the care that they need. And the concept of MAID is now not being discussed because, obviously speaking, they were feeling pressured because the doctors were bringing it up. I got another contact from one of my supporters, and she was very upset because her husband, who this is an older couple, but her husband, who was quite elderly, was quite ill. And she contacts me and she says to me, Alex, why have the doctors brought up MAID 5 times? 5 times, she says. Now, these are different doctors. Like every time they see a doctor, suddenly the doctor's talking about MAID as an option. She's saying, can't they understand? We're not interested. This is pressure. We feel pressure. You know what I'm getting to? Being an advocate is very important when you're talking about these situations where someone's feeling pressured in a vulnerable time of their life. Advocates Code of Conduct. Well, it's in our booklet. You can read it, but I'll go through it quickly. I will practice with compassion and respect for the person with whom I'm working with. My primary commitments are to promote the health, safety, and rights of the person. I will be transparent in my work with the person. I will maintain privacy on behalf of the person and keep confidential all activities and records. Okay. I will guide and assist the person in medical decision making, but at no time will I make decisions about health or medical care or medical services on their behalf. I will respect the person's values and belief system as the foundation for the decision making. Elder abuse and other problems. So when we go to, I'm going to finish this last section, then we're going to go to our questions and answers like before. So I'm going to go to the elder abuse section. And elder abuse is something that's been talked about a lot lately. Thank goodness, because in fact, it's been a cultural problem for a while. It's just that for the longest time, it's been sort of hidden. We haven't talked about it. And now it's becoming more apparent as an issue that is capable of being talked about. And this is important. Now, one of the issues with elder abuse has been the fact that it often happens, if not most often happens, within a family setting, within family or friends. So you have a situation where the person who's the victim of abuse often doesn't want to report the abuse. They don't want to report the abuse because they would be having to report their son. They have to report their daughter, their granddaughter. They'd have to report their neighbor. And they're often also somebody in a situation where they might be feeling alone, or this is the only community they have, and I don't want to get them in trouble. So there's a lot of reasons why elder abuse went on, and it was underreported. They talk about how underreported elder abuse is. Now, here's the thing. We're not going to go in looking for signs of abuse, but we're suggesting to you that there might be a time where you might see signs of abuse. And obviously speaking, this is not a pleasant situation, but you can't be silent about elder abuse. There's no way. You cannot be. Now, how do you know it's elder abuse? At first, you might not know. This is absolutely correct. It might be, someone might say, I fell, this is, I burnt myself, and it might be true. It might be exactly the case that they had fallen or they burnt themselves or whatever. And who am I to know? But the fact is, if you see the same thing happening over and over and over and over again, either this person needs to have some caregiving happen in their home because they're falling a lot, or you have some elder abuse. And that's just in the physical pain issue. Okay, then there's the issue of finances. So what are the signs of abuse? Sores or injuries, especially if they're in certain places in the body, right? because now they're less likely to have been a fall. It's more likely that someone might have been grabbed or pushed or things like that. They don't really have a proper explanation of the injury. Now, someone might have a bit of dementia, as I say, so there could be that is the reason they really don't have a proper explanation. Nonetheless, the fact is we have to be concerned when these things are happening. They're not seeking care for their injury. Now, why wouldn't they seek care for an injury? Because it was elder abuse that happened by their son or their daughter or somebody, and they don't want to seek care because then they'd have to tell the doctor, oh, my son did this to me. They don't want to go there, so they just did not seek care for their injury, okay? They are very messy or unclean in appearance. That means they're experiencing low self-esteem. There might be other reasons for it, but often they're really going through a difficulty, right? Malnutrition and weight loss. You see someone losing a lot of weight. Now, obviously, they could be sick. That's true. But you have to be concerned about these things because that could be that there's a lack of care. Let's say someone's in a nursing home and you've recognized that they've lost a lot of weight. They've lost a lot of weight. Well, why did that happen? I don't know why that happened, but what I do know is it could be a sign that they're not receiving the care that they need, right? Dehydration. Well, Kathy already talked about dehydration before. Dehydration is a problem for older people. Older people often, they don't have that same sense of thirst as maybe a younger person would, but on top of it, their body deals with fluids in a different way as we age. It starts changing. Our bodies change as we get older. And so if someone's not being cared properly, they're experiencing neglect, there's often signs of dehydration. And we'll get into that in a second. They might be afraid of you. You might go to reach out your hand, they act like you might be hitting them, you might hit them. Well, why are you doing that? Like obviously we want to keep our space, and that's already been mentioned before, but I mean, obviously there's signs and someone seems to have some fear of you. That's a big indication, right? Financial fraud. Someone who did well all their life. They had a nice home, their home was sold, now they're in a nursing home, and the nursing home might be expensive, but they have no money whatsoever, and they seem to be in the lower level of the care unit because there's no money, so they're only receiving. What happened? What happened? Or they're in their home, but they don't seem to have any money for food or anything. What's happening? Well, financial fraud is the greatest form of abuse that's going on, and I hate to say it, it's common. Exploitation, sexual abuse. Well, they might actually say something which gives you a sign that something inappropriate's happened to them. Sexual abuse would be harder to find in itself. Obviously, sores or injuries, like you might see something, you'd say, like a sore on the arm or on the neck or something. You think, well, how would that happen? Physical abuse is an act of violence, and it may result in pain, injury, or impairment or disease. Neglect is the failure to provide the goods or services necessary for functioning or to avoid harm. So these are signs of abuse. There's physical abuse, there's other types of abuse, there's neglect. Neglect is common also. Someone who, let's say they have a family member helping them with their finances, and so they're receiving X amount of dollars per week in order to make sure they can take care of all their financial needs, etc. But they never have any money. Well, what's happening to that money? Who's taking it from them? Why don't they have any money? The doctor or healthcare provider is not notified. That's a sign of elder abuse. Now, maybe there's other reasons, but usually, why aren't they contacting the doctor over that? Why aren't they? They have a smelly or dirty wound. Well, it could be maybe this person's older and having some dementia and these kind of issues, but why do they have this? That's neglect. That's serious neglect when they have a wound and it's not properly, cleaned. They're not being properly cared for. These are serious issues, neglect. Remember, infection leads sometimes, very often, to death, right? So if you're noticing these things, I'm not saying we're going to go into a home and see this happen. We hope not. But if you notice these things, these are signs that something is very wrong here, okay? The person has not received any medical care. So they seriously have issues and they're not receiving any medical care, okay? Most common injuries are bruises, pressure sores, and fractures. So obviously we understand bruises could be caused by many things. Abrasions, superficial injuries, they involve the outer layer of the skin. and they're caused by movement of the skin over a rough surface. So obviously, you know, if I grab somebody, I might hurt them, right? Or if I push someone, if I'm you know, physically doing something that way, these are evidence of a physical abuse and neglect that's occurring. Okay. Bruises. What happens when a blood vessel ruptures? So I've hit somebody, I hurt them. They may say I fell down, and that's why I have this bruise. But let's say you go and 2 weeks later you visit them again, and they have another similar bruise, not the same spot. Oh, I fell. No, I think like maybe they did fall, but it's becoming like, what am I going to do? Like, I can't, you can ask them questions. I would ask questions. I would ask them simple questions. I would realize that we're dealing with something very touchy for that person, but I would ask some few questions and see what is said. Often they might say something. They might feel it was their fault. You know, I must have upset my daughter. I must have upset my neighbor, right? I must have done something wrong. You know, they may, they may suggest the cause of the injury was something, or they may actually tell you, right? I did something, you know, and I upset my son. Common location of a non-accidental injury is, you know, is the thing like a face or a neck or things like that. Because an accidental injury, there's more places on your body that are likely to be accidental, and there's other places on the body, if there's a bruise, probably not accidental. Doesn't mean it wasn't, but I mean, these are things you got to instantly say, oh, I feel uncomfortable if there's something going on here. I can't remain silent if this is common. Result of tissue being exposed to heat above 50 degrees, you get a burn, okay? And these burns are categorized by the level of the burn, but also how much surface area it covers, okay? And it affects the damages that person's skin, etc. But also, it often may lead to infection. Burns also are, how should they affect an older person in a more extreme manner than it might affect a younger person. So let's say I experienced a burn. It's at the age of 53. I'm going to heal quicker than someone, and I might not have it might not be as bad on me as someone who's 65, 75, or 85. So when the data shows that, you know, someone who's 65, that's double the national average for them to have death due to burns. When they're 75, it's triple the national average, and when they're 85, it's quadruple. So burns can lead to death, right? And more likely if I get older, how it affects my body. Fractures occur when an external force greater than the strength of the bone is applied. So therefore, you know, I get hit and I have a fracture, or I get a broken bone somewhere, things that happen. So I've been hit very hard, an external force, right? And older people are more susceptible to these injuries, like a bone injury or a bone, because of bone disease, but also their age, right? So an injury is more likely to occur to them. So if they have been hit, they're more likely to have a broken bone or an effect where they have an issue around that when they're experiencing abuse. And common sites would be a hip or wrist, but elderly people are at risk of spontaneous fracture. That's correct, but at the same time, we have to be realistic and recognize that these could be abuse. Lacerations are the result of a blunt force characterized by the splitting of the skin, right? So it's common in physical abuse, but it can occur with neglect. So these are things that you might notice. And if someone was experienced a physical abuse, they've had cuts and things like that happen to them, okay? And then the pressure sore. Pressure sores we know are a real issue. So let's say someone has in a nursing home and they've gone to the point where they're not able to really walk around very much anymore, or they don't get all walk around and need a wheelchair for assistance and things like that. They might lay in bed for a long period of time. And so we talk about this whole issue of they had a pressure sore, right? And that pressure sore resulted in what? If it wasn't treated properly, it resulted in infection. And then the infection does what? It results in death. It's very painful, these infections. So they're getting antibiotics for the infection. The infection was caused by what? The pressure sore. The pressure sore was caused by what? They weren't being turned. They weren't moving around, so they were always in the same part of their body. So let's say somebody is in a bed and they let's say they wear a diaper or, you know, a pad of some sort like that because of That's the reality. They're not getting up anymore to go to the washroom, things like that. And now we're not really caring for them. We're not turning them. We're not keeping them clean. We're not helping them to make sure that we're not doing the standard of care, the prevention of pressure sores. And then they develop a pressure sore. These are serious issues, okay? To me, that's neglect. But we hear of it all the time. And some people say, well, it's the lack. So let's say someone's in a nursing home. They're going to say it's the lack of staff that's causing this. It could very well be the lack of staff that's causing it in a sense. But the fact is, it's still neglect nonetheless, because it can be avoided and it can be prevented. Abuse or neglect occurs when a person is restrained in a non-critical situation. I'm one who doesn't believe in restraints. I understand there might be certain times with someone who might get aggressive that it might be seen as necessary, but I really don't believe in restraints. I think that the idea of restraints is something that should be completely gone. I understand that in the past, the 1960s, 70s, etc., restraints were more common then. But imagine being somebody who has a certain level of dementia who we're restraining now. And we're thinking that this is providing a benefit because if someone might be a little bit aggressive in that, or they might have certain issues. We don't want them to walk around and we don't want them to fall, so we've restrained them. So let's think about this. Do you think that it's going to provide them a benefit? Sometimes the restraint, you could say, is too type of, what often it does is it leads to them worsening in their behavior, because now there's still a person in that body and they're being restrained now. So now they're getting even more aggressive. Now they're upset because they just don't understand why they are tied down like this, okay? Restraint is strongly associated with increase of injury or death. There's actually certain places in certain countries in the world that have actually said we don't do restraints at all anymore. And I'm of that sort of belief system that restraints are completely unacceptable. As much as I understand the concept behind it, that someone's aggressive, and there are other ways to deal with this. You're not going to get into this per se, but these are realities, okay? Skin tears. In sites other than the arm or legs, or multiple tears and abrasions, this should raise suspicion. We should be concerned. I always point out, especially if it's become common, like you're seeing them every second week or every week, and there seems to be this problem. Well, you can't remain silent if it's occurring all the time. Somehow we have to find out what's going on. How do you protect this person? Skin tears can often heal without scarring, so it could be very common, okay? Often malnutrition is a mark of neglect. Not recognizing cultural food preferences might also be a problem here, but if someone's in a nursing home and they're not being helped to be fed, and they need help to be fed, and they're experiencing malnutrition, this could be a serious problem for that person. What about persons who are living still on their own at home? And, you know, sometimes proper nutrition is difficult for them. So to me, especially let's say they have a son or a daughter or someone living with them or coming in regularly, you hear someone who comes in and say, well, you know, I'm helping my son out. Well, you know, you're not eating yourself properly, but you're helping your son out, you know. In a nursing home, they're going to say, once again, not enough staff. Well, there's proper feeding techniques and improper feeding techniques, and we understand this, but, you know, family can be very important in these situations, but also a caring person to help them with their nutrition. Dehydration. Dehydration is so common. I don't know if you read the articles out of Quebec, the COVID, when they're talking about the COVID abuse that was going on in certain nursing homes. And we understand that there might not have been an intention for this to have happened, but a lot of people died of dehydration. And it's very sad that this has happened. And so I'm just saying, well, what are the signs of dehydration? Someone has a lot of confusion. They're sleeping a lot. So, you know, the response, if you don't, you know, if the physician or nurse doesn't ask enough questions, might be, well, we're going to give them some sort of drug to help them with their confusion and things like that. And what they needed was more fluid, more water. What they needed was to be properly cared for. Risk factors. Well, how about medications? Kathy already talked about this in the past, in the earlier part, about decreased absorption of medication, etc. Dehydration affects the ability of medications to do their job, because obviously speaking, the body needs to have enough fluids to work effectively. I'm going to say something else about this. Like, I get a lot of calls about this issue because someone might be dying. They're dying. They're not quite in the final stages, but they're approaching these stages, and they're dying. And maybe the physician has suggested, or a nurse has suggested, well, we're just going to end all hydration and all food and fluid. We're just going to stop all that. We're just going to provide some analgesic to keep them comfortable, and then they're going to die a natural death. And I always respond by saying, well, no, because now you're actually causing their death. Like, there's a difference between actually being near to death and you're actually dying, and you're approaching that time, but you're not there yet, and your body needs hydration and nutrition. There's a difference, obviously. But I always point out that the person who is nearing death but not quite in those final stages, they don't need a lot of hydration, really, because usually they're not running around anymore. They're not doing a lot, but they need enough for the body to function. So because often the person will say, oh, the doctor told me if we keep giving your mom hydration, she's going to have fluid overload. Well, I agree that that's a concern. Fluid overload is a definite concern. But at the same time, why does it have to be fluid overload? They don't need a lot of fluid. So long as we provide enough fluid to keep their body functioning, we're not going to have fluid overload either. There might come a time where the body's actually now shutting down. And that's a sign that death is occurring, meaning they're experiencing organ failure. The body is not able to really deal with the fluids anymore. And you can see that they're pooling, right? The fluids are gathering at a source, or the feet are bloating because at their extremities, the circulation system is shutting down, so the fluids are gathering. These are signs that death is actually coming now, okay? But that's totally different now when we're actually identifying clear signs that death is clearly approaching, and someone who's not experiencing those clear signs and actually needs hydration. People with dementia may not recognize that they are being abused. That's true. It's absolutely true. They may not be able to report it, the abuse, and they may not be able to talk about it. And they certainly may not be believed if they do say something about it, which is even worse. So let's say someone has some dementia and they're saying, well, you know, my daughter had, or my son, or whoever did this to me, well, they may not be believed because they have dementia. Well, someone has to believe them because the abuse has to stop, right? The abuse has to stop. I think things are getting better now in a sense because we've been talking about it so much in the culture now that people are starting to recognize that you can't just leave it. You know, you can't just let that happen to someone. That's absolutely wrong. Self-neglect. Well, this often accompanies dementia or mental health issues. Someone is going through self-neglect. And so the person becomes very vulnerable because of self-neglect and their dependence and their feelings and what's going on. And this is often really highly connected to abuse also. So someone's experiencing abuse and they are experiencing depression and they're turning to self-neglect. So the only thing we can do when we're recognizing there might be some issues of self-neglect is we're there to allay the depression. We're there to visit, we're there to be kind. You say, you know, your life is important, you know, you are important, and we're trying to affirm the person. The whole point of the program is to affirm the person. Alcohol abuse. 5% of older persons experience alcohol abuse. Might be higher than that, I'm not sure, but that's about what the data says. It's more common in men than women. Culture shifting, so that might change in the next few years where just as many men and women experience alcohol abuse. Lower levels, you know, it affects our ability to deal with our illnesses, right? It affects many things, alcohol abuse. Financial abuse, well, let's just be honest. People who are older in this culture, if you look at the, do very simple Google search on who owns the wealth in our culture, it's older people. And the next generation would like to have some of it. And some of them aren't willing to wait. And some of them are very unethical. And some of them are abusive. Some of them actually might have been, I would say, had this feeling of entitlement as children already, because they may have grown up in a family that had some wealth already and had a feeling of entitlement. But it's become a serious problem. You know, widows, widowers, experiencing financial abuse. They call it the crime of the 21st century. Certainly it's common now. I know people who've experienced it. I was dealing with someone who was experiencing it. They're living in the community amongst us. There's signs of financial abuse when they never have any money at all. They don't anymore. Why's happened? It's been taken. It's been taken over time. Sometimes the person willingly gave it because they thought, well, I'm helping, but this is abuse. It's abuse. And then it leads to further neglect because now suddenly at a certain point, they don't have any money anymore. Their finances are gone. They're getting help from the government maybe because they are so poor now. But all of it's been taken from them. And remember, then when the money runs out, is the abuser going to stop there? No, they don't actually. Okay, Compassionate Community Care. Here's who we are. It's a charity. And we have lots of time for discussion. We still have 39 people with us. We have actually tons of time. How will we respectfully deal with adult children of a parent who sees assisted suicide as a possible answer to ongoing chronic pain suffered by their parent? This is a very difficult issue. As I say, the issue of assisted suicide and euthanasia, there might be a child who sees that as a good answer to a parent. Now, first of all, I've pointed out that somebody, you can stop, sure. Somebody who is considered competent is going to make decisions for themselves. It's when they're incompetent that these other pressures come in also on them. Now, even someone who's competent might be feeling a lot of pressures, as I'm saying, being contacted by this woman in British Columbia whose son who has a disability and also has cancer is being pressured towards euthanasia, MAID. And they're talking about MAID and they're bringing it up and they're it's almost like a pressure. They might say, no, we're just providing options. Right off the bat, I would say for yourself, you should always have, we have a document called the Life Protecting Power of Attorney for Personal Care. I would suggest you own that document. We only charge $10 for it, so you can get that from the Euthanasia Prevention Coalition. It's the cheapest $10 investment you're going to get. You sign it and you appoint someone to be your power of attorney for personal care who you trust. If your eldest son or your eldest daughter is the one you've appointed for your financial issues, that's fine. I'm not really too worried about that. That's not my issue. My issue is your life and your health. You appoint someone who you share values with. So therefore, if one of the ladies from the league who's been a friend of yours for years, who shares your values, is willing to be your power of attorney for personal care, put their name down as your power of attorney for personal care and tell them, can you please represent me? And remember, they're only representing you when you become incompetent. The other thing is write down your values. So for instance, a man who was disabled from birth, and he was very concerned because of his disability, how certain people treat him. He's not treated like, he always feels like he's being treated inappropriately, because if he needs medical care, what do they see first? They see a guy with cerebral palsy, and he's in, now he'd be around 60, and he says, I'm not treated appropriately. So he wrote his values in a letter saying, this is how I feel, this is what I believe is right and wrong. And he asked his doctor to put it in his medical records. He says, put this in my medical record. And the doctor said, I want to assure you, I would never do euthanasia. I believe that's wrong too. I agree with you, he said. But he said, I will make sure this is in your medical record because I might not be your physician. So therefore, if it's in your medical record, maybe, just maybe, it will be noticed. We also have a card, and it's very straightforward. It says on it, do not kill me. Actually, the idea did not come from me. It came from a woman in Calgary. And she's, actually, I believe she's a CWL member. when euthanasia, assisted suicide was legalized in Canada, she got a tattoo on her arm. You might have heard of the story. And it just says on it, do not kill me. And I thought, well, tattoo's pretty intrusive. I'm not going to tell you to get a tattoo. It's not a good idea. And I've always thought tattoos are a bad idea, believe me. But a card in your wallet, well, maybe they won't notice it, but certainly that would give them the idea. How do you protect yourself? This becomes the issue. This is why we really have been promoting the program about caring for your own. The people who go to church with us, the ladies in the CWL, they are your own. They are your community. They are the people who we share values with, right? And it's important that we recognize that. What was the name of the form that I mentioned? Is the life protecting power of personal life protecting power of attorney for personal care. They do vary by province. The Alberta document and the Ontario document are nearly identical, so it's not an issue. What it does is it very clearly states your values, and it makes it very clear that you would not want euthanasia, you would not want assisted suicide. It even says that even if I should ask for that, take that as a request for pain and symptom management. Okay, so we're recognizing that you might be in a tough time of your life, and you might be losing hope. You might be going through an emotional crisis or an existential crisis in your own life, and you might actually still ask for it. Like I told you in the earlier session, I had been contacted by a woman whose husband had been involved in pro-life as a leader in the 90s, and here he's dying, and suddenly he's asking for euthanasia, and he never supported that. He never supported that. And she finds out from him that a nurse had spoke to him in the middle of the night and convinced him. Actually, she talked to him about 2 hours. Actually, the wife had found out this nurse thought that it was the best thing for him. You know, whatever. And he's going through a vulnerable time of his life, and he actually changed his mind because of his personal circumstances. One of the things we made wrong in our talk about euthanasia in the past is we talked about vulnerable people. And what we should have done is talk about people at a vulnerable time of their life, because we all go through vulnerable times of our life. This affects all of us because we are human, right? We all experience the same human emotions, the same human feelings. We will all go through those difficult times of our life. Every single one of us. A woman was dependent on a feeding tube and living in a nursing home. She and her family were being pressured to pull the feeding tube. They refused. Her care got so bad they hired a lawyer. When the lawyer, yeah, so this is things that happen. When the lawyer got to nursing home, they found out she was only getting 200 calories a day. Yeah, well, you see, let's be brutally honest. There are some excellent care homes. There are some not so good care homes. Now, we know this now, especially post-COVID. We know that some of the care homes had some serious problems. We know that. And there's some people who have said to me, I would rather die than go to a care home. Okay, so I understand the mentality of how things are. If you ask me personally, I don't believe in care homes unless they're absolutely necessary. That's just my belief. I believe that we should be caring for people in the home. I believe in home care. I believe if you're going through a difficult time and you need support, that support should come to you in your home. Why? Because that's where your community is around you. That's where you have lived. That's where you are comfortable. That's where people are who care for you. So if it's possible, unless it's absolutely impossible, like there might come a time in someone's life, as let's say that they have some really, their Alzheimer's developed to the point where it's really becoming almost impossible to care for somebody in the home. You understand there's a reality. But I mean, if it's possible to care for someone in the home, then it should be done. The other thing it does is it humanizes you. You're part of that community. I'll give you an example. The woman who used to live across the street from us, so when Genevieve was younger and we first moved to the mighty metropolis of Glencoe, Ontario, where no one lives except for a few people, there was a woman living across the street who was elderly, and when Genevieve was much younger, she used to visit her regularly. Well, you see, here's a woman who is part of our community, right? She is intertwined in our community, and she's being visited by this young girl across the street because, well, it's just something she's doing. They actually got along quite well, etc. But the point was, you're part of a community. You're identified now. But if you put someone in a care home, so, well, they might have people around them, but now you've taken them out of their environment that they've been all their life. Certainly a church environment, you might be looking at your Catholic Women's League list and saying, where does Joan live now? What happened to her? Oh, I think her daughter moved her somewhere, and you're trying to figure out, well, where is she? Hard to visit somewhere you don't know where she is anymore. You know, she's not in your community anymore, even though she might be still alive and needing you to be part of her life, right? That's how I believe. First of all, with the advocacy, and it's a non-family member, obviously we're saying you should sign an agreement with them. We're telling you should never be doing anything to represent yourself per se. You're only representing them. So I don't know why they'd be getting upset. There was somebody I was involved in for a fairly long time, an elderly gentleman who I was helping out, and it was difficult because his family were still in his life, but I was the one who took control over everything. I took control of the finances. I took control of his health care, everything. And I was actually did it because I knew the guy quite well, and he was actually being abused, and it was not good. It was not good at all. So I took over, and then some of his family members were quite upset about it. Not all of them. Some of them were quite happy about it, actually. For me, it was a real problem because it took a lot of time. It was very, anyway, nonetheless, let's get to it. So a couple of family members were quite upset about it, but they were actually the abusers. Yeah, I think communication is always very important, but I mean, you're actually helping them. And they should be actually thankful that someone's actually willing to help them. You know, they could be paying for an advocate. Gosh, that would cost some money. There are people who are professional advocates, and I don't have a problem if that's what you feel you need to do for someone, like your mother or your father, that you have a professional advocate for them. But the fact of it is that costs money, and in this case, we're talking about you helping a friend. Is really what we're saying to you. In this case, you're helping. We're helping our own, right? We're caring for our own in our communities. Advocacy at a doctor's office is also important for people after brain injury. Absolutely. Someone who's like I mentioned dementia, but someone could have a brain injury. That's correct. Some of the people we may come in contact with will have had a brain injury and may not fit under the specific groups listed. That's absolutely true. The biggest thing about advocacy is to say, instead of physical restraints, they switch to medical restraints. I know. I'm not a fan of that either. You know, they want, so you go to a nursing home, they want everyone to be asleep by 9 p.m. They want them all to wake up at a certain time because they have to be ready for breakfast. Everything's got to be on the schedule. If the person doesn't fit on the schedule, suddenly we have a problem because we only have so much staff. Well, I'm a human being and I don't really fit on a schedule. Like I might have my own schedule, but I don't really fit on a schedule. So now you're going to drug me to make me fit on the schedule. I'm not a believer in it. I'm sorry. I don't believe in this. You could say, well, Alex, it's easy for you to say. Well, fair enough. I agree. And who am I anyway? I'm just a euthanasia prevention guy. But I come into a lot of these issues with people, and I absolutely do not agree with this. Can this program also be done for a couple who are isolated and lonely, though they have each other? Absolutely. The other thing about it is when you're visiting someone, it's good to visit not alone, unless you know them well. It's good to visit in pairs. Why are you doing that? Well, obviously speaking, there's a protection for each other because you don't want to, let's say someone's caused a problem. Well, you know, these kind of issues that could occur with a potential abuser visiting somebody is not going to happen if there's two people visiting in the same way. It's just not going to happen because obviously there's another witness there. But secondly, it's a protection. So it's a protection for the person you're visiting, but it's a protection for you too. Okay. And we could, now, if you know somebody really well, this is a totally different issue. But obviously, we're training you, talking about issues about people you may not know well. Because if you know someone well, you don't need a program. You can just call them up and say, hey, Mary, I know you're probably alone right now. Can we talk? And Mary would be happy to talk to you. Mary would probably be overjoyed that someone's talking to them. It's good to be done in a parish or a group type setting. So if you're doing it with the Catholic Women's League, or if you're doing it within the parish or a church community or whatever that might be, then you would just say to the person who you're working with. So if it's in a parish setting, there's either the pastor or there's the pastoral minister, who's ever, you know, the person who's you're working with. You say to them, I don't think we're a fit. And you would be very honest about it because you don't want to be in a situation. Now, the other thing is, the nice thing about the program though is you might decide you only want to really spend an hour every 2 weeks at talking to people. Well, that's fine. But someone else might love doing this, right? And they might say, I'm going to spend a lot of time at this. I'm looking forward to this. And so therefore they might become someone who sees quite a few people. So that means if you're working alone, like you're just saying, I'm going to help some people in my community, then maybe it could be awkward. You're right. You're absolutely right about that. It could be very awkward.
There's a question privately that was asked. I do not have clarity how we will be matched with people to do the visit.
Yeah, I saw that here, and that's what I was saying. Like if it's being done within a church community, then that's who you have to work. That's who you'd be working with, and that's what we're actually suggesting here. That it's being done. In this case, it's the Edmonton CWL who we've organized this for. But I mean, you're working within a community, so therefore, we're offering a service in the sense that should hopefully exist, or maybe exists somewhat already. But the idea is that you're working in a community, so we're not just running off. It's possible someone on this call becomes the coordinator in their parish community, or the coordinator for the CWL for the Archdiocese of Edmonton of such a program, because they're thinking, I could do that, and that would be very helpful. But that's all depending upon how God calls you, right? You may or may not feel the call to do that.